welcome everyone to the April, what month are we in? April.
Tuesday was something.
April meeting of the Universal Health Plan Governance Board. Let's get started with a roll call.
Hang on one second, we're having echo. There we go.
Oh, no, thank you.
Great, just checking the audio again. Welcome to the April meeting of Universal Health Plan Governance Board. Is that better?
Still here's some echo there.
Okay, one more check. This is the April meeting of the Universal Health Plan Governance Board. Sorry for everyone listening online. We have some audio issues. We'll be ready to
I
start.
think so, I've got muted on both of mine. Thank you though.
Testing. Okay, does it seem like the audio is fixed?
No.
Not yet. Oh, okay. Sorry.
You talk just a little bit.
Me? This is the Universal Health Plan Governance Board April meeting. Happy post-tax day.
We are testing our audio.
Testing.
Was unbelievable.
Try again. Welcome to everybody. We're going to be starting in just a minute as soon as we fix our audio.
You're so sorry.
Hello.
I know, well, there are always technology issues, yeah.
Yeah.
To
Yeah.
We're about to get started with a roll call. We're just testing our audio.
The next section is really already started. Yeah, he's already working on it. That's challenging. That's like you. Yeah, it is professional. Yeah.
Are you, you have an echo, so we're wondering if there's somebody else
She sent in after,
after.
yeah, and I put it on. mute.
I'll see if I can get Steve here.
So,
Okay.
thank you. Just let me read this.
Yeah, yeah. Thanks for your patience, everyone. We're just sorting out some audio issues.
Yeah.
We got it?
We're good.
Yay.
Awesome. Thank you to Isabel. Appreciate it. Okay, let's get started with the roll call.
Okay, Helen Blanca,
Here.
Chen Wei Chi,
Here.
Amy Fellows.
Here.
Michelle Glass,
Here.
Goldberg is on leave, Judy Richardson. Oh, he was absent today. Cheryl Ramirez.
Here.
Mary Lou Henrich.
Here.
Mike Leahy.
present.
Thanks, everybody.
Great. So we have a very busy meeting today. Just as a quick agenda review, after our executive director report, we're going to be reviewing and possibly voting on some aspects of the revenue plan. Then we're going to be hearing from Morgan with Echo Northwest about the reserve strategy. After the break, we're gonna look at the full complement of proposals from our committees as a start to sort of our reconciliation process and making sure that we're all putting the plans together in the way that we intended. And then we're gonna do some planning about how we're gonna tackle our remaining decisions on that plan. After the break, then we'll review the final report from Milliman and move into committee report outs from CECC and the transition committee. So yeah, it's gonna be busy as always. Before we get started, let's take a look at the consent agenda. I'm looking for a motion to approve the consent agenda or pull anything off of it if you desire. On the consent agenda today are 3 items. One are the March meeting minutes, the OHA readiness report, and then the policy on executive director expectations. So either a motion to approve the consent agenda or to pull any of those off. Go ahead, Mary Lou.
I hate to be the one on pulling the minutes off, but again, it isn't just a typo this time, it's just a word that changes something or so, I don't know.
Okay, let's pull the minutes off.
Okay, all right.
And then is there a motion to approve for the consent agenda, the OHA readiness report and the policy on executive director expectations?
Yes.
Amy,
Second.
Amy moved, Mary Lou seconded, and any discussion? Okay, let's do a roll call vote.
Helen Belanca,
Yes.
Chen Wei Chi,
Yes.
Amy Fellows,
Yes.
Michelle Glass,
Yes.
Goldberg is on leave, Judy Richardson is absent, Cheryl Ramirez.
Yes.
Mary Lou Henrich.
Yes.
Mike Leahy.
Yes.
Thanks, everyone.
Okay, so you have the floor, Mary Lou.
Okay, on page 8 of the minutes, there's just a word that I believe is incorrect. Mike asked when board members, it's about midway down, can share the document, this is the one created by the CECC, for the focus groups with the broad audience. Here it says from the focus groups. And so the intent was that it was for the focus groups, and I just thought we should change that one. And the other one that kind of just concerns me overall, but it isn't about voting on the minutes, is there's so much content in these minutes every single month. And I'm just nervous that we don't seem to have a plan where it says how it's gonna be. When we say we're gonna do something and a real plan for who's in charge of making sure that happens, or where does it go, and is it all me, maybe, but anyway, but just, I would like to change that word on page 8. Document created from to the document created for the focus groups. Other than that, I move with the approval.
Second.
And moved and seconded. Any further discussion? Okay, let's do a roll call vote.
Helen Belanca,
Yes.
Chen Wei Chi.
Yes.
Amy Fellows.
Yes.
Michelle Glass,
Yes.
Goldberg is on leave, Judy Richardson is absent, Cheryl Ramirez.
Yes.
Mary Lou Henrich,
Yes.
Mike Leahy.
Yes.
Thanks, everyone.
Excellent. So moving into public comment, we've got a few pieces of written public comment this month. Sarah Haynes wrote to encourage us to make sure the UHP offers comprehensive care, including dental, vision, chiropractic, massage therapy, mental health care, gender affirming care, abortion, psilocybin therapy, and to ensure pharmaceuticals are manufactured regionally as much as possible, and to consider the role of food security and agriculture as well as alternative treatments. We received an email to the board that said in its entirety, is this going to be just another soak the rich income-based tax scheme? Brett Moore from Montevilla Sewing Centers wrote with concern about the payroll tax and suggested it be covered 2/3 by the employer and 1/3 by the employee. Stephen Moreno wrote to suggest that since Providence Health Plan is up for sale, we should buy it. Chris Patterson wrote to ask how the UHP would be funded. That's all the written comment we received. We can go to oral public comment on our voting topics. So today there are potential votes on some aspects of our revenue plan, and that's the only potential voting topic today. But we have several people lined up for that. I'll start with Alex Polkoff if you're ready.
Thanks, I am. Can you hear me okay?
Yes.
Great. Thank you all for what you do and the opportunity to comment. So I would like to comment on the revenue proposal that's potentially going to be voted on. And since it's the day after tax day, it's appropriate. So one of the things you're going to be looking at is the HSRR, the household size rate readjustment. I urge you to keep that. If you get rid of that, that's going to take that personal income tax up above 11%. I think that's just not going to fly at all with the public. It's already too high. And we need to have a product that is going to be broadly acceptable by the public and by the legislature. And along those lines, I urge the board to pay attention to that minority report done by Chen Wei-Chi and Jeff Goodman and John Santa. Particularly with regard to tax rates, they mentioned bubbler, the broad-based low rate is the most acceptable to the public. There are levers you can pull. Right now, you've got thresholds on both the personal income tax rate and the payroll tax that are kind of arbitrary. Those are levers you can pull. There's also the EPT credit towards the personal income tax that can be adjusted. The whole idea is to get the rate lower and also get broad owner. That also goes with broad ownership, that broad base. So have people feel like they have a stake in this system. And lastly, along those lines, the rates, it's the same rate for both personal income tax and payroll tax that everybody pays. It's an effectively progressive because of the thresholds. Again, I think I've said this before, but I urge the board to make it a really progressive tax with marginal rates, kind of like the Oregon income tax is set up right now. So anyway, thanks again for the opportunity to comment, and I'll yield to the next person.
Thank you, Alex. Next is Mike Huntington.
Okay.
Chair and members of the board, thank you for the opportunity to speak today. My name is Michael Huntington. I'm a retired radiation oncologist from Corvallis. Thanks again for all of your work. I urge a vote no or no vote on the current revenue proposal. My concern is about the cost estimates you're using, especially the Milliman report. From what I understand, Milliman did not fully account for the savings that clinics and hospitals could achieve if Oregon adopted a truly simplified, even if imperfect, single-payer system. Our current system relies on multiple insurance companies, complex billing rules, and several layers of profit-seeking middlemen. That complexity drives up costs through duplicated paperwork, confusing claims processes, and large administrative staffs in clinics and hospitals. Other health systems closer to the single-payer system idea have shown that cutting this complexity can save very large amounts of money, mainly by reducing administrative overhead and standardizing how care is paid for. Yet it appears that Oregon has not carefully measured the direct and indirect costs that this complexity imposes on clinics and hospitals every day. So my question is this: will the governance board commit to commissioning or formally endorsing a rigorous new feasibility study that specifically measures how much Oregon could save by removing profit layers and redundant administrative systems, and by paying providers and hospitals through one unified state-based system? Another study at this point in the marathon? We may suspect we don't have the energy, time, or money, but we must. Without that kind of study, how can the board, the legislature, and the public really know Oregon's true potential for savings under the Universal Health Plan? And why would they even consider supporting the plan? Please vote no or don't vote on this revenue proposal. Thank you.
Thank you, Mike. And Richard Gibson.
I'm Richard Gibson. I'm on the transition committee. I'm commenting on the voting topic of the revenue plan. I think it's okay as far as it goes, but it needs refinement. I think it is okay to approve the basic revenue plan with 6 caveats. Number one, we need a careful accounting from national health expenditure accounts categories of what is in the UHP and what's not. Things like maternal and child health, vocational rehab, VA, things that can be split between being in the UHP and not being in that. So we need a spreadsheet that clearly defines that. Number two, I think we need to commit to engaging advisors from British Columbia and Taiwan to help quantify the payer side of administrative savings under UHP. Number three, we need to commit to a process to quantify the provider administrative savings under UHP, as Dr. Huntington just said. Number four, then once we know how much the provider side can yield in administrative savings, we need to commit to making a decision about how much of that reverts to the UHP versus how much would stay with providers, meaning splitting that administrative savings one way or another. We need to make a firm decision on that. Number five, we need to commit to asking the legislature to direct the Oregon Prescription Drug Program to arrange to buy pharmaceuticals for all Medicaid patients in Oregon, because that's a source of huge savings for UHP. Although it doesn't have anything specifically to do with UHP, it can help us. And number six, we need to commit to allowing a refined estimate of the UHP cost to be submitted to the legislature this fall after the final report is submitted in September. I mean, the idea, let's go ahead and submit the plan in September, but allow for careful refinements of the financial piece following that. Thank you.
Thank you very much. Okay, at this point, we can move to the executive director report.
Snoopy mug out of the way. All right, good morning, everyone. I'm Dr. Mimi McDonald, Executive Director of the Universal Health Plan Governance Board. So just have a brief update. You can go to the next slide. All right, so I thought I'd speak first about the board outreach that has been happening. As people are probably aware, HCAO has initiated putting on town halls throughout Oregon. And we have our board members have very graciously participated in these, have given up of their time and have spent a lot of time doing this. There's more coming up. And so grateful to our board members and to HCAO for organizing that. I'm sure the board members at a different point will talk a little bit about that, but that's been, I think the experience overall has been great. I also wanted to mention, I had the opportunity to attend the HHS, tribal cluster meeting that was in Warm Springs at the beginning of the month to speak with a lot of people in the tribal communities who are involved in health and human services to discuss potential for engagement with the Universal Health Plan Governance Board and in what way they would appreciate to learn more about our board. Next, I spoke last month about our 2027-2029 budget with a policy option package and legislative concept that we are working on. And I just want, nothing really new has changed about that, but I just want people to know that is continuing to go through the process through the state. And next, I did want to speak about some anticipated board member changes that will be happening. So first off, I'm not sure how many people are aware, but Michelle Glass's term on the board was set to expire in January of 2026, but she has very graciously continued so she can continue work on CECC all the way through, and she'll be going through September, but and I'll let Michelle say a moment about this, but after September, she will be rotating off the board, and I just can't even say how grateful I am about that. And also our other amazing part of the dynamic duo of the CECC team, Amy Fellows, she will be finishing up her term at the end of this year, at the end of 2026. So she too will be rotating off the board, which means that there will be 2 board member openings, one which will be filled starting in October and then the other in January of 2027. So staff are busy working on revising the process and opening up the application process. We'll keep everyone informed about how that works and all of the steps involved in that. But I just can't thank everyone enough for, and Michelle and Amy for the work that they're doing. They're not gone yet, but.
And I think we both are specifically community.
Thank you. Yes.
Public engagement.
Public engagement.
Public engagement. So those are
Yeah.
those are the people who will be recruited to fill those spots. Thank you, Amy. And I don't know if Michelle and Amy, if you wanted to say anything.
Just that this has been a great experience and that I have really enjoyed it. But in the next year, I have a child kind of in a transition to adulthood age that is gonna need a lot of support, and I need more time for that and for less volunteer work.
Thank you, Michelle.
I'm just grateful for the hard work of the board. It's been a challenge and an honor to be part of this work, this phase of the work. And I am just really sad to be rotating off in September, but grateful for the flexibility. Thank you, Chair Helen, and thank you, Mimi, for allowing me to extend past January so I can see us through the report. That was really important to me. I don't like leaving in the middle of a project. So grateful for the flexibility, and encourage anyone who might be listening to consider applying. It's a big role, and there are many people who went before us and laid the foundation. We've done the best, thoughtful, careful work we can, and there'll be lots more work that'll need to happen moving forward. So I look forward to supporting the board in its future work once I rotate off in September.
Thanks, Michelle. Yeah, and I'll echo Mimi's gratitude for your willingness to stay on through September, and to Amy's, all of your work on the board is great. And I'm sure there'll be a more formal goodbye once we get closer to it. But yeah, just to acknowledge that. So yes, I also echo Michelle's call. Anybody listening who's interested in applying for a position on the board, I would encourage you to do so. And I want to mention at this point too, that I'm a big believer in groups like this of rotating leadership. I think that leading this board it's a community effort. We need as many voices as we can. I fear I may have overstayed my welcome. I'll remind the board, you remember that we started with Vice Chair Warren George, and then we transitioned to Vice Chair Judy Richardson when Warren left the board. And the hope was that Judy would then step into the role of chair. And then we had a changeover of executive director, and grateful for that. But there's been a lot of movement in terms of leadership on the board. And I would encourage any of you, so Judy has made it known to us, and she said it was okay that I share this, that she will not be able to step into the role of chair. She's going to be remaining on the board, but she has had some great work opportunities come up, and she won't be able to take on that role. So while she'll still be on the board, she's not going to be stepping into chair. So I would invite any of you to let me know if you're interested in stepping to the role of vice chair, with the goal of then taking vice chair as soon as you feel ready and able to do that. And then as we think about who we want to recruit to the board, I would keep those leadership roles in mind. That we should be thinking about folks who would be interested in joining and then stepping into leadership roles, because I think rotating leadership is super important in work like this, and I would be open to suggestions. Yeah, go ahead, Cheryl.
Aren't most of us rotating off by next spring 27 or June 27? That's what I was thinking.
So it's different. Mimi may know more about this than I do, but when we originally were appointed, we all got staggered terms. Some of us were appointed for 1 year, some for 2, some for 3, and I think a couple of us were appointed for an initial 4-year term.
Oh, okay.
I know I was appointed for a 3-year term, which ends in June of 2027. Yeah.
Yeah.
But then when you get reappointed, if you want to stay on the board, everybody, when we get reappointed, is appointed for a 4-year term.
Oh, okay.
So they stagger you for your first appointment, and then your re-up is for 4 years.
Okay.
And so it depends, on kind of what your initial term was and when you re-up, but yeah.
We can send out an email that has everyone's
Okay.
everyone's dates. Thank you.
Yeah, if you don't remember.
Yeah.
Great. Any other thoughts on that? Yeah, please come talk to me if you're interested in vice chair. I'd love to talk about it.
All right, and then I just wanted to once again give kind of a formal thank you to the members of the Plan Design and Expenditure, Finance and Revenue, and Operations Committees. They are, they are all completely wound up. And just so incredibly grateful for all the work that those committee members have done, all the people who've not even been on the committees, but have participated in the work, and encourage everyone to continue participating in their process. So again, thank you all so much for that.
Yes, and I'll again echo that from Mimi. Thank you to our Operations Committee, Finance and Revenue, and Plan Design, as they have officially wrapped up. Grateful for that.
All right, and next
Sorry.
slide.
Go ahead,
Oh,
Mary.
so go ahead, Mary.
Do we need to do something, because it seems like, I know there's been discussion from some finance and revenue committee members, et cetera, about processes and whatever. Do we need to take some kind of a vote to really in them, I mean officially, or are they just, because I don't know that we did that. I don't know.
Well, when we created the committees, we gave everyone a timeline and deliverables, and that timeline expired. So
Okay.
so in effect, we did, because
Okay.
we committed to a timeline and then that we.
I just wanted to be sure that if I was talking to a couple of people or something, that I wasn't breaking some public.
Yeah, no, the committees are
Rules.
officially ended.
They're
so you
officially
can-
ended.
Yeah, so you can. talk
Okay,
to-
I could, okay, thank you.
Yeah.
Okay, just
Unless
clarifying.
they're on the transition.
Yeah, that's a very big thing, so I don't think I'll talk to 12 people.
All right, thank you, everyone. And then just as always, a budget update. So this is as of February of 2026. A couple of things to know that just some slight budgetary changes because of the February 2026 budget revision. There was an additional $54,421 put into the budget. Of course, with that, there was also an increase in professional services outgoing, just because of the way that the state works. So it's essentially ends up being a little bit of a wash. But where we stand at our budget right now with what we have budgeted out, which is all of our current consultant groups, if they were to meet their NTEs in the remaining budget, we have approximately $49,000 left, not left over, but we have $49,000 that is not yet accounted for in our budget, but that needs to make it all the way to June 30th of 2027, which is to say that's not very much money. So I just wanted to see if there's any questions about that.
But there is a little.
So, Mimi, the actual and planned, that goes through June of 2027 as well. So in terms of
Correct.
staff and everything like that, that's all included in that planned number. So
Yes,
this is
correct.
This is, yeah.
So yeah, actuals to date and then actual and planned. Yes, you are absolutely right.
Okay.
Okay, and I think that is it for me. Oh, except that you get me again. Sorry, everyone. All right. So, what I'd like to do, I hope that, oh, yes, please.
I just wanted to thank you for doing this every month and letting us know. When I joined the board, it was a little unclear and that apparently had been an issue that hadn't been happening every month. And I just want to say this is very helpful as we look at what we can and can't do. And we can also question and what's in some of those if we want, but I just want to thank you
Oh, you're
for
welcome.
doing
Thank
that every single month and getting us clear on it. Thank you.
You're welcome. Thank you. All right, so moving on to speaking about more money or less money or money at all. So again, I hope that people have had the opportunity to review the summary proposal, and we'll go on to the next slide. And just so people are, kind of remember what the summary revenue proposal summary is about, is really that this is the revenue plan created by Finance and Revenue Committee in relation to the revenue replacement target created from the 2022 data. All right. Of course, the dollar amounts and percentages are amenable to be changed as things move along. And really what we're hoping to do here, having this high level summary, so we get make sure that everyone feels confident of the understanding of the major tenets of the revenue plan proposal. So board members and the public. So this, we have a good amount of time. And so this is, and we have experts in the room. This is a great time to bring up nagging questions, because this is, this is an opportunity to do that for the board, because sometimes we go through things rapidly. So next slide, please. I wanted to talk a little bit about how this came to be. The Finance and Revenue Committee adopted an accounting-based approach. So it to adjust current spending to reflect any key structural differences between this, oops, there's a typo, status quo and a universal system. Dadgummit. Tax year 2022 was used as a common analytic baseline, and a revenue replacement target of $16.9 billion, that's in 2022 dollars, has been used as the reference point. So all of those percentages that we have been talking about are in relation to this revenue replacement target, which I don't want to go into too much detail, but which does actually include both payer and provider savings related to a universal health plan administration. So it may not be to the extent that some people would prefer, and I want to be clear about that, and there's absolutely going to be more work done on that. But just so people understand that this does include some of that, and in fact, slightly more than what was included in the Optimist report. So pause there for a sec. Okay.
Yeah, I mean, to put a finer point on that, the estimation was that the revenue replacement target would be somewhere between 14 billion and 24 billion dollars as a range. That's what we thought we might have to replace between 14 and 24 billion dollars. And we landed on roughly 17 billion, with the assumption that there would be significant administrative savings and efficiencies that would come from a single payer. So we are accounting for that to some extent. I would point out that those savings are still theoretical, but with a really good reason to think they will be there, but we don't have a system to base it on to know exactly how much they will be. And I would also add that absolutely for certain, the first few years of a universal health plan will be way more expensive as we get new structures and systems set up. That happened with CCOs, that there was a rising level of cost, and then Governor Kitzhaber explained that there was a giant shoulder of costs, about $1 billion that they had to spend just to get the CCO set up before savings would start to accrue. And so there will be a lot of savings there. And then the third point is that there will be absolutely savings on the provider side in terms of administrative expenses, but recouping those savings means paying providers less. So the costs of provider administrative that on the provider side that they pay for administration is baked into the fees that they're charging to payers right now. And so if we say, we know you're going to save money, you're not going to meet all these people for administration, but so therefore we're going to pay you less. So that has to be negotiated with all the providers, all the hospitals and all the clinics and all of the independent practices. That lowered rate of reimbursement will have to be negotiated. So it is potentially there, but not guaranteed there. So I think estimating a replacement target of 17 billion is pretty optimistic. And in terms of administrative savings, and that's what we're basing it on. In fact, I worry that it might be a little too optimistic because of those reasons, but we'll leave it, that's what we're going with. That's where we are. But we have so many comments about administrative savings, and I want the general public and the board to know that we've thought long and hard about the administrative savings that are possible in this program, both on the payer side and the provider side. And we're basing our estimates on a really optimistic number that would account for those savings.
Great, thank you. Thanks for that clarification. So let us go on to the next. We will actually take each of these on their own, so we don't have to talk about this all at once. But just pointing out what, the revenue instruments that have been proposed, the current Oregon rate, the proposal, the additional percentage increase, the amount that would raise, and then the percentage of that total revenue replacement target that would come from that particular instrument. So for example, if we look at the employer payroll tax, that's going to bring in about 50% of the required revenue. With the Oregon healthcare personal income tax bringing in about 40%, and then you can see more or less what other portions of this given. So I think this is important for people to recognize that as it stands now, these are how much each of those instruments are contributing to the whole. So just something to kind of keep in the back of your head. All right, next slide, please. So again, we're going to go over these, and this is the perfect time for people to ask questions and, express thoughts. So a corporate income tax add-on is included to ensure that corporations that are doing well, that are profiting, are able to contribute directly to financing the universal health plan. It also diversifies the revenue beyond just those wage-linked sources. As we saw, it's not a huge percentage of the total, but it is a percentage. And of course, it will impact businesses in Oregon. So pause there for a second. All right, next slide, please. All right, corporate activity tax. So this is for a tax added on to broaden business participation just beyond firms that are having a positive reporting taxable income, and also to provide a steadier base. So if we think of, you know, income cycles and businesses doing better or worse, and it's a very small percentage, it is a percentage of just general activity, corporate activity, to balance out a little bit when there are economic downturns. Okay, next slide. Thank you. People, we are familiar with this, the employer payroll tax. That's the primary tool, and that to replace the employer's current share of today's employer-sponsored insurance spending. It ensures that employers continue to keep participating in a way that is broad-based and predictable. However, it doesn't tie individuals to a specific employer. Everyone who is living in Oregon will still get coverage. So that is the main thing. I think one of the other important tenets of this employer payroll tax as it stands now is that the first 500,000 of the employer's payroll would not be taxed. So businesses that have a payroll of less than 500,000 would not pay any employer payroll tax. Every other business would start paying tax on their first $500,001, not that first 500,000. So Mary Lou, please.
I guess I have struggled and tried to understand and think about all the nuances of this employer payroll tax. And I guess as being part of that Finance and Revenue Committee, we wanted very much to disconnect the idea of insurance or healthcare coverage from an employer. And currently now, some employers, many employers pay at least part of the premium for their individual staff. If we would, maybe we'll get onto it when we talk about the credit on the personal income tax. One of the things that hadn't really struck me at the time was that it doesn't totally break that bond between employer and the individual who works for them. Because if you're going to get a credit as an individual, and if I work for a company, then it has to be tracked to me, kind of thing. It is like, I had first thought it was just an employer payroll tax that, you know, 9-point-something%, and that it wasn't tracked, had to be tracked back to the individual. But if we're going to credit the individual, it still does have to be. So that is an administrative piece. And I struggle back and forth with the idea of the credit, which helps people who are employed by an employer who, you know, makes, you know, so if the employer has payroll more than 500,000, then as an employee, I get that benefit. But if I work for an employer that doesn't make 500,000 in payroll, there's no credit for me as an employee. I mean, there are many different nuances of this whole thing, and I'm still struggling a bit, even though I was on the Finance Committee and went through this. I'm just wanting to say, I'm still having some ambiguity about what we proposed and how we're moving forward with it. For a couple of reasons. I think it could be felt as unfair if I work for a company that doesn't have 500 million in payroll.
Mhm.
Therefore, I don't get any of an exemption for my personal income tax. And also the fact that it still is gonna have administrative stuff around it to be able to track that Kaiser's Helen Belanca, that you get that credit, but we have to know that Kaiser paid it for you, not the firm. But yeah, so anyway, just the complexities of this are not easy. I think Cheryl would.
Yes.
Yes, okay. I'm not saying I'm against it. I'm just saying for the discussion with the public about how we wrestle with these things.
So you're absolutely right, Mary Lou, that it still has to track to the person. But I think the problem we're trying to solve is that if people don't have to stay in their current job to get their same
Correct,
benefits.
yeah.
So people will have the ability to work for themselves or work for a different company and make those choices freely without having to stay in a job so that they can keep their healthcare benefits. That's the thinking
Absolutely.
we want. But the financial linking, you're right, they have to prove that they're paying on behalf of somebody.
And if you move mid-year into another
Right.
employer, it's just got complexity of administration.
And then I actually worked out the actual percentages that people would pay, and I'm not sure that they're right, so I don't want to show them, but like by my calculations, in the example that you gave of working for an employer who's paying the payroll tax and not, the difference in the marginal tax rate that they pay, like I call it the effective HCPIT, is less than half a percentage point.
Okay,
So like if you work for an employer that does pay it and you get the credit, it's like 6.5% is your effective HCPIT. And if you work for one that doesn't, you're paying 6.9 or something
Okay.
like that. Like it's within half a percentage point different. It is different,
okay.
but it's not dramatically different from what I've,
Your
worked
math,
out. I actually
yes.
ran some numbers and see how it would work
Yeah.
out.
Thank you.
Yeah, so it is true, there's a little difference, but I don't think it's big.
And so then that makes the question of, is it when we give back basically half of what the employer payroll tax is putting into the overall pot, and then we give half of that back to individuals like us, it takes away from the total amount of money that we're able to
That's right.
use. And
That's
so
right.
there is a piece of me that, although I understand the economic theory that
Yeah.
an employee's his salary isn't, their compensation package includes their salary and their benefits. And so that's part of the reason that we went with the crediting back. And I still am struggling with, would it be better to not
Yeah,
credit that back?
it's one of the levers that we have,
Yeah.
and that several have been brought up through public testimony. And so the HCPIT and EPT thresholds is a lever, the EPT credit back is a lever. And the benefit package itself is a
Yeah.
lever and just offering fewer benefits. We have a lot of levers if we decide that this is not a revenue plan that's gonna meet the needs or meet our principles.
Yeah.
Yeah, so, but yes,
Okay.
I agree, it's one lever that we should think about. Yeah, thanks for bringing it up. Yeah, Chun.
Okay, I try to explain, there are at least two very important rationale for why employer payroll tax and why the credit. And the reason are related. One important reason is historically, for decades, particularly when we have more active unions, unions tend to negotiate employee compensation, particularly emphasizing the health insurance benefit, because since 1980, we experienced very high inflation rate. The inflation rate of insurance premium way exceed the employee payroll. And so historically, the insurance premium employer pay, if they did pay for the employee, has been an integral part of the employee benefit. And this is the historical system we inherited. And that's why an important, both for the employer payroll tax, but also for credit, because this was and has been part of their compensation. A two totally different reason, but related to that, is to give credit, the employer payroll tax credit to employee. Politically, is very important for support, because for most people in the middle income range who currently receive their employer insurance benefit, some of them, they don't have to pay, particularly for individual. And some of them, they have family, they pay for family, like myself, for the public systems, I pay for my family. But if I'm single, then I literally didn't have to pay. And then for those people who are comparing universal health care, you have to pay the health personal income tax. But the status quo, I don't have to pay. There's a huge resistance coming from these people. So for two different reasons, why we need employer payroll tax, why we need to credit. Similarly, why we need to credit Medicare recipients. We don't want the Medicare recipient to compare status quo versus universal health care. They're worse off
Yeah.
With the universal healthcare. So there are political reasons, but also historical economic reasons.
Thank you.
Michelle?
Thank you, Chair. I have a process question. As I was reviewing the documents for this meeting and reading the minority report, which I really appreciate the thoughtful work that went into the minority report from the Finance and Revenue Committee. I have some concerns about voting today on these different elements of the very preliminary draft, and I would, I think we all acknowledge incomplete draft proposal without also understanding what that means and how we are we also going to vote on a clear statement from the board to the legislature that will be included in the report, making it clear that this is not a revenue proposal. This is preliminary work. These are elements, and that these laying out the steps that will need to be taken and funded by the legislature in order to make it a complete revenue proposal. Because I have a couple concerns. One, in some ways, I think I fear that we're setting up our own straw man that will be easy to shoot down for people who don't like the idea of a universal health plan before we can even get the full analysis done. And then I think it also could undermine trust in the process and in the board's work if people look at this, and we're not going to have a chance. I think, Helen, you've done a great job in this meeting of explaining all the complex nuances. We're not going to get that chance with a lot of people. A lot of people are going to hear about this in the media or, from an organization who has a position for or against, and we're not going to get to answer all those questions. So I guess before we start voting on the elements, I kind of wanted to pull back and ask that bigger picture question of like, are you asking for just confirmation from the board that these elements can go to the transition committee to wrestle with, the minority report and contextualizing these elements with a clear accounting of what is yet to be done and the limitations of the analysis we were able to complete with limited time and resources? Or is this a vote on a preliminary plan that will be presented as such to the legislature?
So it's not the role of the transition committee to work out the revenue plan. That's not their role. That's not a deliverable that they have. It's this board's job to work out a revenue plan. And I would say it's the primary role of the existence of this board is to develop a revenue strategy for the plan that was mostly laid out by the task force. The main reason for this body to exist is to explain how we would pay for the plan that was really worked out by the task force. So this board, not the transition committee, will eventually need to decide on a revenue strategy that we're going to put in front of people and say, this is the best that we came up with. And yeah, poke holes in it. Let's see what works and what doesn't about it. My goal for this meeting is to make sure the board understands each of the elements of the revenue strategy and that we agree with the principle of it. You don't have to necessarily agree with the exact number because the exact number may change depending on other decisions we make in terms of the levers we were just talking about. We may go up or down on the exact numbers, but we need to agree on the elements of this plan and say, yes, this is what we want in the revenue strategy. We may or may not be able to get to a vote today. We're required by public meetings law to alert the public if there may be a vote, and there might be one today, but there doesn't have to be one. And if the board doesn't feel comfortable voting today, we won't. Although I would say we need to decide soon. We're, coming to the end of our work, and, our agreement on the revenue strategy is linked and, conditioned on, our other decisions are conditioned on our revenue strategy. So if not today, then I would hope we would do some voting by May. So does that answer your question, Michelle?
It does. Can I request then as a board member, or just put on the record that my preference would be to go through, make sure that we all do understand in each element. And then when we vote, maybe at the next meeting, we also have a draft statement from the board on the future work that would be needed to make this a full revenue plan that would fund a UHP. Because I don't think that this is, I think we all agree, this is not complete. And that statement, I would feel more comfortable voting on the elements if it was also included in that. One of the elements was that statement that made it really clear to the legislature and to the public what the limitations of this plan is, that we understand it's incomplete, and the laying out the clear steps for the completion of this work.
Yeah, I guess I struggle with the term completion. I guess our job is to put forth a proposal about revenue strategy, and then, yes, all kinds of caveats that we didn't necessarily have the time or the expertise or the, resources to delve into it at the depth it needs to be delved into. But given our limitations, this is our best proposal. And these are the elements that should be there. This is our best guess at the numbers we would attach to each of those elements. And put it forth and then with a qualifying statement saying, yeah, this needs to be looked at 2 and 3 and 4 more times by other folks and other experts. And consider things that maybe we haven't considered. But yeah, to your point, our goal today is to understand all the elements. And make sure that we're in agreement that these elements should be there, and then put together a best proposal from there. I think Mike or Cheryl, yeah.
I was going to bring this up at the time of the vote, but since we're talking about it, I really believe that Richard's 6 caveats get to that narrative that Michelle is talking about. And I would like to urge the board to include his 6 caveats with the motion and the vote. And I think we'd get there with what we're trying to achieve here. So that's what I was going to just amend whatever motion to include Richard's 6 caveats. And I really believe that would suffice what he laid out.
Is it possible for Richard to send an email to Isabel with those 6 points, or to get them from the minutes and then quickly put them into a slide so we can see them up on the?
Oh, you mean right now?
Not right this moment, but at some point during the meeting, so we can keep going with what you're doing.
If you send it to me, Richard, I'll make a slide.
Yeah, and then, because I want to let Mimi kind of keep going through the elements, because we have more to cover. before
We do, but Mike and Mary Lou, if you
Yeah,
have
yeah,
more about this, sorry, I'll do Mike first, then I didn't know which order it was, Mary Lou.
I was gonna make some comments later, but I'll give you a little preview thing here. Since our last meeting, I have just learned so much from so many of you that I want to give, not blame, but credit to some people that have changed some of my thinking in the last 30 days. In listening to Lee and us trying to think about, is this going to be likely a big bang, or is this going to be rolled out? An important nuance is that if you're just looking at a revenue plan in isolation, and if we're just looking at kind of the ongoing, there are there are a number of things that confound this, that if we approve this revenue plan, we may be doing wonderful things that are a mistake. So let me say what they are. We've got to be a lot clearer about if this isn't going to be a big bang, but if there's going to be some eventual development of the plan over, let's say, I'm just going to invent here, a 3-year period or whatever, the numbers change. So the taxing piece changes, et cetera, right? Second, there are some things that I think are highly questionable about people's current thinking about how much money do you need in this entity. I happen to have been in some very big organizations that are even, they're comparable to this. And people are seriously talking about trying to create 3 months of reserves. And like Helen, I don't really believe this is going to be 80 billion, but it'll be 65 or 70 or whatever. This is an enormous amount of money. And for people that are making believe that we can come up with an easy plan to have 3 months of money there. And then to not be thinking through the fact that maybe we'll start with just Medicaid and public employees, and then, I mean, other things will evolve, and we haven't been clear on that yet, but again, I credit Lee for challenging some of my thinking about this. I think that's the context that we've got to judge, is this the right revenue piecing? Now, I personally, I don't think we actually need 16 or 17 billion dollars as just by today. I think we're gonna have more savings that we anticipate. But that leads me to my last piece. While Shumway has made various points in various meetings, I don't think we've really heard it. You know, candidly, some of the analysis stuff based on American health, and I've been a health plan manager, so if anybody else has been, you know, you can argue with me, but there's just so much crap and so much overhead and so much complexity that if we're skillful at reducing and simplicity, there's no way in hell we're gonna spend $5 or $6 billion in administrative costs. That's ridiculous. Now, I can argue the other side and say, well, that's a total overestimate. On the other hand, we've got to have some strategy to fund the transition and the reserves. So I mean, I think there are good arguments on either case, but I guess my caution is that we really haven't. I agree with Richard's piece, and I thank him for all the work that he's done. But I also agree with Shumway that we're not being bold enough in our thinking, and whether it, as you all know, I've been talking with people, and I'm advocating for some new funding, and I know people are arguing me because there's all kinds of process arguments, but let's forget process aside here. The content is that none of us believe this damn thing is going to cost $80 billion unless we're really incompetent and hire up 5,000 and 10,000 and 15,000 people for administration. So I just ask that we at least listen a little bit more to what Shumway has been saying and what's been my international experience. And that's, you know, if we simplify things, there's no way in hell we're going to accept some of these Milliman and other projections. And I think we need to get serious with that and then say, okay, that does not mean we shouldn't vote for this. This is close, and this may be the right algorithm. But I don't think we've yet appreciated that global best practice can really help us do this successfully. And I think that's what we should be arguing in public.
Thanks, Mike. I appreciate that. I want to emphasize too, that what we need to get through today and decide on is the elements of the revenue strategy, that we all agree on what they are and what role they play. We do not have to agree on the number, like, that it's going to be this much of a payroll tax and this much of a personal income tax. That number can potentially change, and we're not dealing with that today. We need to understand each of these elements and agree that yes, we want an employer payroll tax. Yes, we want a personal income tax, that kind of thing. And so let's just get through the rest of them. Mary Lou, go ahead and make your comment, but we're right now talking about employer payroll tax, and then Mimi's going to go through the rest of the elements, and we can have a more broad discussion.
Okay, my question was back to, okay, we, this group, sit here and with our limited abilities and knowledge and whatever, okay, and are trying our best. But I guess I'm going back to your statement, Helen, that it's not the role of the transition committee to figure that out, those more of the details, then whose is it?
Ours, the board.
I just don't feel comfortable that we have that capacity to do that. I mean, I kind of thought we put the transition committee together with members from each of those other committees. And so the Richard and Charlie being the two finance committee members, and me peripherally, on that committee. And I thought that they would be chewing on some of the more details and bringing it back to us.
So the role of the transition committee is the transition between the current status quo of how healthcare is delivered and a UHP. How do you play out that transition? What happens first? What happens second? What happens third? How many years is it going to take? What order do you do things in? That's the role of transition committee. this board has some very difficult questions to wrestle with. I'm not, I don't have the training or the expertise either to make some of these questions, but it's our job to tap into the resources that we have. The experts that were on the committee, the consultants that we have, we need to talk to whoever we need to talk to in order to make the best decision we can, get recommendations, and then use our judgment. That's why we're on this board. That's the purpose of this board. It's this board's role to make that decision. So we have a lot of resources at our disposal, and then this board needs to vote and decide on that. Go ahead, Amy.
I feel from that last conversation that we just made a case why the Finance and Revenue Committee shouldn't have ended. Because that's where the expertise was, and then they were bringing us things. Now they're gone. So
They're
I
not
didn't-
gone. I mean, in the sense that the people are not gone. The committee has ended because we cannot support the committee any longer with staff time. That's the committee extended 6 months beyond their original timeline. We gave them a timeline and a set of deliverables. That timeline was extended 6 months. We can't support them anymore.
So what I'm saying though, is either we need like more special board meetings where we're focused on this and we're inviting the right
People to talk.
people
Yeah.
to talk to us or something, because I think if we just come back here every month, I feel like we just continue to have the same conversation and we never
Right.
kind of get
So we're
enough. into
Today,
the-
we're trying to give more of the weeds. Right now, what we're trying to get through in this discussion is go through the weeds of this so that we understand it, and this is your opportunity to ask questions. If we want to set up more special meetings, of course, we have the ability to do that. And so, but yeah, in the next month or two, we need to understand all these elements so that we're prepared to vote on it. So we've gotten a recommendation from the committee. We have consultants at our disposal. And if you have questions or you don't understand something,
But the
please-
committee's not in agreement, that's why we have a minority report, right?
Right, so we need to consider both the opinions, the official vote and why the vote, and then what the minority report said. Right, so, and then we need to make the final decision, but we hear input from whoever we need to hear from. Yeah. This is the hardest thing we will do by far, and so we need to avail ourselves of the resources that are at our disposal.
I guess back to what Amy's saying. I just, in terms of the process, how to bring these other experts and voices and people to the table while we're having the discussion, I guess.
Great, so at the end of every meeting, and again, at the end of today's meeting, I will ask the board for what questions you have, what topics we need to cover in our next meetings. We ask that at the end of every meeting. If you have things you need more information on or want to understand more, please raise it at that time, and we will have a presentation on it at our next meeting. Or you can seek that information out in between meetings if you prefer. But yeah, so any information that you need, we can bring it to the board.
Right, if I may, I'd like to make a clarification too about some of the work of the transition committee, because it is evident that unless the question around savings of a universal health plan is resolved, this board does not feel comfortable making further decisions. So the transition committee is working on the evaluation of administrative savings. We had a big portion of our meeting was dedicated to that at our last meeting. We're doing more work, and then there's going to be another one, and then there will be for sure a recommendation to the board. Not necessarily a vote, but so that those people who are on the committee and others, so that work will continue in terms of that. So I just wanted just
Okay,
to
that's helpful
clarify
to know.
too, that as someone said, does this mean that the transition committee is batting cleanup? And no, that's not their entire role, but in order to, because we looked at this, what decisions need to be made, and definitely that information needs to be brought forward to the board, and the transition committee members are helping with that. Yes, Mary Lou.
Okay, as one of these transition committee members, I feel like what Helen is saying, and I don't disagree, that we've got all these puzzle pieces that the various committees and the board have, kind of sanctioned to a point, and they're here. But some of those pieces aren't done. And I think that, like you say, the biggest job is the finance and revenue plan. I mean, that's the thing that's going beyond what the task force didn't do.
Right.
And so I'm just feeling like that puzzle piece isn't quite finished. And I want to be sure, and that's what I thought, that at least maybe a portion of the transition committee would be working on,
Right,
to
that's,
help
that's what
us.
I
Is
just
that-
said that
is
they
that
are
what you
doing.
said?
Yep,
Okay,
that's
'cause
what I said, and that's
it's
what they're doing.
Not what I heard
So-
Helen say.
Right, administrative savings are not the same thing as reconciling the revenue strategy.
Yeah.
Right, so the revenue strategy and what's included in the revenue strategy, they're related in the sense of the numbers that we need. But what I'm trying to talk about is the elements of the revenue strategy. Is there an employer tax,
I get
Right.
that.
payroll tax,
Yes.
and is there a credit? That's the board decision.
Yeah.
Right,
Okay.
and then how much we need, it partly depends on what we anticipate the savings will be, so that's where the numbers come in. The numbers we don't have to deal with today, we're just trying to talk about the elements. And the transition committee cannot decide the elements of the plan, we got recommendations of the elements from the finance and revenue committee, and that's what we're discussing today. Yeah, Mike.
Just an observation. I sense that, we, by having so many governmental processes, we are, with the best of intentions, somewhat making some excuses about not making certain decisions right now. I mean, candidly, I know enough to have an opinion on what we could do. I also recognize that depending on how skillful the people that succeed us are doing, they're either gonna make this thing work, or it's gonna be another big governmental bloated
Yeah.
bureaucracy. That said, I would like to, there's two perspectives here, and I just want to identify the elephant in the room here. There's a kind of process perspective of you gotta do X by such and such. And as I've said at transition, many I've said here, that's gonna produce a vanilla, lovely, high level report thing. I think the governor and others should demand more of us. We should be clearer about what's gonna be in the plan, clearer about not just my opinion or Chunway's opinion, but having some additional work done. I know there's a problem because there's some elements here that believe come hell high water, we're gonna have a report by September 15th thing. That's, I've never really bought into that one, but I get that perspective. There's another perspective, and I think Richard identified it here today, is there's some additional work with caveats that with that we could all agree with. And I'm just hopeful we can have some dialogue here about if we can agree on that stuff, and if we could agree on a fact that maybe we don't have the numbers exactly right now, then I think we can do what Helen is urging us to do, and I support that. Right?
Okay.
What I don't support is too much getting into process la la land here, and that's driving me a little bit
Right,
bananas.
well, let's go on then
Yes.
and get through all of these
Good.
parts
Yes.
of the plan that you all can talk about and kind of focus on that. Thank you. Okay, so where were we? All right. Healthcare personal income tax. I think, I'm not sure how many questions people have about this, but this is a central mechanism for individual contributions will come from households that file, and again, an Oregon
Yes.
income tax. Want to be clear about that. And this is designed to replace, what people would pay either, premiums, deductibles, anything out of pocket, with an income-based contribution that reflects ability to pay. I think that this would be a great time or something to think about the way that it is structured now. That it is the income up to 200% of the federal poverty level would not be taxed. It is, although the tax is progressive in that when, people of higher incomes pay more, in its current iteration, It is not a marginal tax, so it doesn't go, I mean, that's not the way that it's designed. I'm looking over to Richard, so hoping you're right. So it is not a marginal tax and it is not a tiered tax.
Right.
Just so people are clear what it is and what it isn't. That doesn't mean that it can't be, but, and this is the time to, it's a great time to have that discussion because I think that has come up for people, just to understand. All right, take it away, Chunwei.
Just,
And Richard, come, please come sit here.
for clarity.
So, yeah, just as a formality, pardon me, Chunwei, just as a formality, I want to just get consent from the board to invite Richard to join. the
Yeah,
table
thank
to
you.
join the
Apologies.
Discussion. He's technically not a board member, but let's just do a quick roll call vote that we're willing to invite Richard to the table and participate along with the board members.
Ellen Belanca,
Yes.
Chunwei Chi.
Yes,
Amy Fellows.
Yes.
Michelle Glass.
Yes.
Goldberg is on leave. Judy Richardson is absent. Cheryl Ramirez.
Yes.
Mary Lou Henrich.
Yes.
Mike Leahy.
Yes.
Thanks, everyone.
Great.
Thank you.
you.
Apologies. Sorry, Richard.
No, thank you.
I have one question, one comment related to personal health, personal income tax. One is you mentioned, but I believe we haven't come to the final decision about 200% federal property land,
Yeah.
because there's a trade-off. If we set that high, that means those who have to pay will pay higher rate. So we were still considering whether it will be 200% or lower, such as 140 or somewhere in between. So I want to clarify that. I don't think we come to the conclusion.
We did vote on it.
You did actually vote on it.
We did.
Yeah,
we
we
voted.
took a board vote.
200%?
We took a board vote and the board voted for 200%. Yeah.
Okay, my mistake. Okay. Second is on clarification, is the health care personal income tax, how we define taxable income is the same as the state tax? What is taxable income? This is different from income.
It's
We start with federal adjusted gross income, federal AGI.
AGI.
That's on the, close to the bottom of the first page of Form 1040.
Yes, but how about compare with Oregon's taxable income? Because if we are different from Oregon's taxable income, then there will be a controversy about why we are setting different.
Well, we start with federal AGI, but then Oregon treats social security income differently and our tax tables account for
Yeah.
that.
But it does start with federal AGI. You
Yes.
Take that line 11 and you move it over onto your, I just did my tax.
Yeah,
Okay.
that's what it is.
It's line 11, okay, so it's not the adjusted income. On your federal form, you have everything included, so it includes if you have capital gains, if you have any employee stuff, if you have social security or some percentage of it, and you get your total thing.
Yes, but
Then
one important part of that, particularly related to tax equity, is taxable income after deduction. So we didn't consider that.
No, it started with that total. And then when you get to the Oregon, the major difference, as I understand it, has to do with if you have social security income or not. Over
Yes.
65, and then that gets taken out in Oregon. But you start at this point up here. I guess. I'm jumping. Somebody else. I guess back to the 200%. We did indeed vote, but we have said all of our votes are preliminary and straw votes, et cetera. And I'm wondering whether we should rethink the 138 to the 200.
It's on our list of levers. Yeah.
Okay, I just don't know where that, when we're having these discussions, that I'm never sure if it's something that we're supposed to dive in and talk about now or not talk about.
I would say, let's understand where we are now and what it comprises of. Once we get through that and we say, here's what we've come up with. The 200% exemption, the 500,000
Yeah.
for small businesses. This is what we've decided on. Here's where it landed us. Are we okay with it?
Okay,
And if we're not, then let's think about what we could adjust.
okay,
And those thresholds are something we could adjust. The benefit plan is something we could adjust. We have levers to adjust if we're not happy with it. What we're trying to do now is get through what the plan is that we've actually created and say like, is this right? Do we feel like we're on the right track here? Or are there things that seem off or we need to adjust? And if so, what should we adjust, right? So let's just get through what we've decided so far. We haven't seen the whole plan yet.
And let me just add, related to my earlier comment about taxable income. That might be something need further consideration because we want to promote equity in financial burden. And tax is an important indicator of financial burden. And the basic principle of public finance is two households with exactly same income, they don't have the same burden. Because each household has different situation, different support, different person, different number of person, etc., etc. And this is why taxable income versus the gross income are very important differentiation of the concept. The taxable income take into account the financial burden. Again, the basic principle is two people, two households with same income, they don't have the same ability to pay for tax. And I just suggest that something we might want to have further consideration.
And that's especially true if there's like an independent business owner in one of the homes. You know, I mean, like, the taxable income is very different.
All right.
But roughly though, the HCPIT, because we exclude that first 200% of income, which is about $32,000, I believe, in Oregon. The first $32,000 of your income is not taxed. Then on my sort of homework spreadsheet that I've been trying to work this out at, what it looks like is starting around $50,000, the effective HCPIT is about 3.5%. And as you go up in income toward $500,000 of income, it gradually increases and you get closer and closer to 8. But even at $1 million of income, you're still at like a 9.9% rate, right? The overwhelming majority of people where the median income lies is somewhere between 5 and 7% is going to be the effective HCPIT. So effective meaning like that's the proportion of their income that will go toward the UHP is somewhere around 5 to 7%. Am I like that? Yes.
I
Okay.
think
So even though it's technically a flat tax of 10.1, because we exclude that first bit of income and that the lower you make, the less you're going to effectively pay. So when we talk about what will be my personal income tax on this, if you're in that median income range, somewhere between 3.5 and 8% is where it's going to land for everybody, or 99.5% of people in Oregon. And mostly it's going to be that 5 to 7% is roughly what we could say. Yeah, right. If we're trying to ballpark it.
But
Okay.
this is a whole different issue. You're talking about progressivity of the tax.
yes.
I'm talking about two households with exactly same income, they don't have the same ability to pay for tax because of different financial situation. So that's a whole different issue. Progressivity is one issue.
Right. But how do you solve for that?
That's why the definition of taxable income. The reason to differentiate gross income versus taxable income is to take into account every individual or household's different financial situation. Some people might have a huge debt, or they have to pay school loan, or other things. That's why both federal and state level, they have the definition of taxable income, not just the gross income. The taxable income is taking into account each household individual's different financial situation. And again, the basic principle is two people with same income, they don't have same ability to pay tax.
Okay, so that's, I'm gonna add that to our list of possible levers of using taxable income instead of gross income. I'm assuming that if we went that direction, that the rates would need to go up.
Yes.
We'd have to account for, like,
Yes.
that using taxable income would result in lower revenue generated by the HCPIT. And therefore either increase the rate of the HCPIT or increase our rates elsewhere in the plan.
But it would be more equitable.
Yeah,
More
Yes,
equitable.
Yeah.
And
Right.
Yeah.
I think this was discussed when I came into the finance committee, kind of in the middle of the movie. I was thinking we were doing it on taxable income. And one day I had this like, oh my gosh. And I was told, no, that all of the projections were based on that,
right.
gross income. And I had to swallow hard.
Yeah.
To think, oh, because I was thinking just what you are, Chung Wei.
Yeah.
But then what you said, Helen, is absolutely accurate, that if we did it on that lower rate, then we have to increase the percentages beyond where we are now.
But
So I
then
just want people.
we're further burdening people that are already burdened.
Richard, do you have any comment on that idea? Taxable versus gross income?
A comparison is for figuring out your Medicare Part B rate. The so-called income monthly adjustment on IRMA. They do it based on adjusted gross income and not based on the income after deductions. I mean, it's just
So that's how Medicare payment is determined, is based on your gross income, not your tax.
Not your tax.
correct.
And so we're just, we're following that as like as a precedent or as a best practice.
Yeah.
What do you think about the equity argument that John Way's making and Amy's making about equity would be better with taxes?
I'm not sure that I'm expert. I mean, I don't have any expertise in it.
I don't like the rest of us that got.
Okay, can we put that on our list?
Absolutely.
Thank you.
Kind of a further exploration
Yeah.
and definition, absolutely.
Well, in public finance, there's always this trade-off. If you want to make the financial burden of paying tax equitable, the tax system will be very complicated. But if you want to simplify the tax system, it will be less equitable. Again, the basic principle, people with same income don't have the same ability to pay tax.
Right, right, yeah, that's a great point, John Way, and it kind of, you know, this is where we bump up against our two competing principles, which is to make it simple and to make it equitable, and we can kind of do one or the
And
other.
our number one principle is health equity.
Right, yeah, no, I understand that, but yeah, so the more complicated we make it, that increases administrative costs, right? And like, you know,
Sure.
there's always gonna be some trade-offs there. Yeah. Okay. I'm gonna go back to Mimi.
Right, yeah, any other questions or comments about the personal income tax? All right, let's go on to the next slide. Just more easy topics here we have. Our friend, the household size rate readjustment. So the impetus behind a household size rate readjustment is for when there are higher, and I use that term very, you know, sort of loosely, higher income households that have more members in that household, that they would contribute more to the overall Oregon health plan or Oregon Health Universal Health Plan. They contribute more to the Universal Health Plan than families of the same income, but that use fewer resources. In other words, have fewer members. So the idea being that that would take some of the burden off of a smaller number of households. So smaller number of households, if it's only by household and not by number of people in the household, then households with two people in it would, even at higher income levels, would end up paying just as much as households with perhaps, let's just say 8 people. Now, I am just saying the very, very basic, I don't know, Cheryl, if you want to add anything in there about the rationale of why it was created or the impetus behind it. I just want to make that the premise clear before we get on to more nitty gritty.
I don't think I can add anything.
Or Mary Lou, anything?
I think that when this was brought up, it was again trying to be equitable and to recognize that larger households will have more healthcare expenditure. Theoretically, not, you know, they're probably very healthy and they don't use any, but it theoretically. And that also, I think we keep getting ourselves, because this is how it's always been, as John was pointing out. So insurance has always had something like this, or it's more expensive for the family premium than it is for the individual premium. And we struggle with, or trying to get away from the insurance mentality. But on the other hand, we go, is it really fair and equitable if we don't put something in that actually recognizes that larger families, or, you know, households higher up the income scale, should pay more for their their part of the tax.
Yeah.
But we struggle with this, let's get away from the insurance model and then back to, well, but this is how it's been done, you know, it's
Right.
hard.
To me,
We're
there's
confusing equity and equality.
there's two questions with the HSRR. One is, do we think as a board that two households that have the exact same income, but there's more members in this one than this one, should that household with more members, should they pay more for the UHP than a household with similar income but fewer members? That's like a principal philosophical question that we need to decide. And if we think they should, then how do we make that happen, right? So there's like the principle of it, and then there's the logistics of it, right? So on principle, it sounds like the Finance and Revenue Committee thought, yes, if your household is bigger, it should pay more if it's able, like if it's at a certain
higher
income level, it's at a higher income level, it should pay more than a household that has fewer numbers. So two households, $100,000 income, both of them. But 4 kids and 2 adults should pay more than one adult making 100,000 by themselves. Let's just focus on that question right now. At the exact same income level, should they pay more if there's more members?
But I don't, it's hard for me to focus on that question when we still just opened up the question about adjustable income versus gross, because in combination with this, if we did the adjustable income, it seems like it balances out differently, if that makes sense.
Yeah, you mean the
Because you're-
taxable
The
income.
taxable.
The taxable, I'm sorry, the
Versus-
taxable income
right.
Versus the gross.
Yeah,
in combination with this is different than gross with this.
well, so that brings up the exemption question. Right, so we need to learn more about this, but if the way you determine your taxable income is through exemptions, then that's a separate issue.
Yeah,
But can we just, like, regardless of how we do it, how we figure it out, just on principle, should a household with the same income but more members pay more than a household with fewer members?
I wanna know more about the members. Like, how many?
But that question actually
Yeah.
hinge upon Emmy's comment.
Yeah,
Let me just first give you example of Taiwan. Taiwan's main finance is through payroll tax, that not income tax, the payroll tax, but then they add a small amount of income tax, mainly payroll tax, largely paid by the employer, but the employee contribute a little bit. And it's graded, progressive. And then if, say, an employee has 5 dependents in the household, the employee will pay whatever he or she has to contribute in payroll tax, multiplied by the household dependent number, but with a cap. The cap start at 3. If you have more than 3 dependents, you are taxed up to 3. And so that can consider both progressivity as well as a financial burden, and without penalize big household. So they kept 3. And then back to our question, whether we want to adjust household size and to make it equitable financial burden is highly dependent on whether we are taxing gross income or taxable income. If we are taxing taxable income considering dependent deduction, for example, so it already built into that consideration of equity and financial burden to pay tax, then we multiply by the number of dependent will be more fair because we already consider the taxable income. And again, we can consider similar with Taiwan, whether and where we want to cap the number of dependent. Taiwan cap at 3, and it's up to us to decide whether and if we want to cap how many.
Okay, I want to do a quick time check first. It's 10:30. We're a half hour over. We had Morgan lined up to talk about the revenue strategy. Can we delay the reserve strategy? Can we delay the reserve strategy conversation till May?
Yes.
Okay. And then even if we delay the reserve strategy conversation till May, we are still at time and need to move on. So I want to ask the board if we want to continue talking about this for like another 15 minutes and shrink our other agenda items. And we need to pay attention to like the time, and yet I want to, I don't want to cut off discussion that is really meaningful. I'd rather stay where we are and keep talking about this a little bit longer, maybe another 15 minutes, and then try to shrink some of the other agenda items, if that's okay with everyone. If anyone objects to that, let me know.
I don't object, I just think this is the issue that I keep trying to bring up about how are we going to, in this meeting, future meetings, do we have to start scheduling some other meetings?
Yeah,
Because
Sure,
this
because-
stuff is
right.
not just quick little agenda items.
yeah, right. And so we're really constrained, being that we're all volunteers and
Yeah,
everything
I
has to
know.
be in public. We're doing our best, but okay. So if we're gonna stay on this for a minute, and we're gonna talk about taxable income. My understanding, and again, this is not my expertise, so please correct me if I'm wrong, that historically, the way you determine taxable income in a large household is with exemptions. You claim exemptions on your tax form. If you have a spouse and you have 3 children, you can claim yourself, your spouse, and all 3 children, so you have 5 exemptions. And exemptions work as deductions, meaning they reduce your taxable income. So if you make $100,000, but you claim all those 5 deductions, your actual taxable income will be a significantly less than 100,000. And in our case, for the purposes of the UHP, the HCPIT, if you've claimed deductions, the HCPIT would be applied after those deductions. Yes,
Yes,
so isn't that on taxable income?
yes. But
Oh, yeah,
dependent deduction is a big part, but not the totality, but it's up to us
Right.
to decide.
right.
Yeah.
So, right, so HCPIT would be applied after deductions. or-
If we choose taxable income rather than gross income.
So right now, it's applied to gross
Gross
income
income.
before exemptions.
Yes.
Yeah.
So it excludes the reality of exemptions.
And there's other exemptions like.
Right. So is that accurate? Right now, the HCPIT would be applied to
Adjusted gross income.
adjusted gross income and not the income that would occur after any exemptions.
Exemptions don't really apply in the 2025 tax code because they were eliminated.
Yeah, okay, yeah. So that was what I was gonna bring up,
Yeah.
is when we're trying to talk about
And the
taxable
federal.
income. Yeah, that the federal tax exemptions disappeared. They were suspended in 2017, 8 years ago.
Right.
And then they were eliminated, permanently eliminated as part of HR1. So federal personal deductions on your tax form like that, claiming your spouse and your children, don't exist anymore, and they're permanently removed in exchange for a higher standard deduction.
Other than filing status. Are you filing singly or jointly?
Filing status, right. But for filing status, so other than that, but you don't claim deductions. Now we have the child tax credit and a
Yeah.
higher standard deduction instead. So I don't know how, right, so Oregon has deductions, but they function as credits and they benefit only low income families. They don't apply at high incomes. So in our discussion here with using the HSRR to ensure that higher income families continue to pay more, this would be like an added amount to what higher income families would pay to compensate for the fact that they may have deductions. But in the Oregon tax code, the deductions only benefit low income families. They don't benefit high income. So we would be adding fees to low income families, again, and according to the Oregon. Yeah,
For Oregon, there's at least 2 big pieces of deduction that's very significant. One is the tax you pay to federal government. That deduct from your taxable income in Oregon. The other, depending on whether you itemize or standard. If you itemize, most people choose itemize because we have a big property tax. So that's property tax is also, if you itemize that, property tax is also take out from your taxable income. You don't put tax on tax. That's the basic principle. We pay tax, we pay tax on property. And those money already gone from our income. You cannot tax that again for state income tax.
I mean, all of this to say that currently, according to the committee, we would use a household size rate readjustment based on exemptions. And exemptions don't exist anymore. So if we think that households with more people in them should pay more, then we can't use exemptions
And
because they don't exist anymore.
the bill that just passed this session about disconnecting some of the pieces that Oregon was tied to the federal tax thing. I'm not sure how that plays into this as well,
Right.
because it did pass.
Right, so it allows Oregon Oregon has just been copycatting whatever the Fed said, and it just allows Oregon to set its own tax rules separate from what the federal government decides. If anything, it would And the purpose of that is so that we can continue to rate, we lost too much money
Yeah,
with
yeah,
HR one.
yep.
So it would be increasing tax rates, not creating more deductions, I would guess, but. Because that was the purpose of that. But the point is, the committee recommended to us that we use household size rate readjustment based on, how many deductions are on your tax form, and we can't do that. So one of the things that.
Well, we have a list of the federal tax form still has a list of dependents. And so it's not exemptions we're based on. It'll be based on filing status and number of dependents listed. That's how we'll calculate. Yeah,
Okay,
so we'll know how many people are in the house.
They're still
okay,
there,
okay, so.
List of dependents.
List of dependents, okay.
rather than talking.
Okay, so
So
if people have dependents, should they, and they meet income requirements, should they pay an additional fee? That's the idea.
Well, dot point two down here, household size 2 and above. That, I don't know, somehow the 2 doesn't seem to me to be a large family or a large group, it's 2 people, so I don't know whether
Dependents.
we could go with, with maybe 4 or 4 or, something else, but we did just.
And that's counter to what Chunwei was saying about capping it at
Right,
3,
three, maybe it's, I don't know.
Michelle, did you have something?
Yeah, I think you keep posing this question, and I guess my thought at this point on whether we should keep the HSRR is that if these levers all move together, and that's what I'm struggling with, if we keep the 200% FPL exemption in place, I feel more comfortable keeping this household rate readjustment in.
Yeah.
I think if we reduced the 200% FPL exemption, we would really risk overburdening low-income families, and that would be the opposite of equity. So I think as long as that piece doesn't move, I feel a little more comfortable about this. And then to Mary Lou's point about, 2 isn't a large group. I don't think this is about large groups or not large groups. This is about, do 2 people use more healthcare services than 1 person? Do 3 people use more than 2 people? Like, it's just, so I think that as long as we're protecting low and middle income families, I feel more comfortable. I think if we start seeing like 4 or more, I think we could see some real disparate impacts that could have disproportionate impacts on communities of color specifically, that would be really contrary to our equity goals as well. So this is hard to look at individually, but with the rest of the structure in place, I feel more comfortable with this. If we start changing other elements of the plan, I think we have to reevaluate the other options because they all kind of they all impact each other.
Right, but in theory, it's okay. And in theory, you're saying you're okay with it.
It's not even really, it's not about the theory. It's about can we, it's about balancing all of the things. Are we protecting low and middle income families? Are we creating a broad enough tax base to make the plan viable? Those to me are more important than a philosophical question because, I mean, think about a family of 4. If you take the household income and you divide it among the 4 members of the family, per person, their income is lower than if you're just looking at an individual who's an adult who's working, because children don't work, they don't earn money. So I don't know philosophically that I necessarily agree that it's important that larger households pay more. I think that is tied to our kind of the embedded assumptions in healthcare as a commodity and healthcare users as consumers and that whole structure. So like, I don't necessarily on a philosophical level think that it's abstractly philosophically important that we charge families more. But I think that as long to meet those different goals, protecting low and middle income families, progressivity in the tax code, as much simplicity as we can have, and a broad enough tax base to make it viable, that I'm comfortable with this piece right now.
So I appreciate your point, but even with, isn't it true that the HSRR only begins at a certain income level?
Above 313.
260% of federal poverty level,
260%.
up to 520.
So in theory, I'm not saying we should do this by any stretch, but in theory, if we removed that 200% FPL threshold, if that went away, this would still only apply at 260% of FPL or higher. It
Yes.
wouldn't
Yes.
affect those under 260% of
Yes.
poverty.
Correct.
Is that, so,
How does that affect families that don't file taxes? Or how does any of this?
well, none, if they don't file taxes, then they don't
don't
get an
pay.
HCPIT and then they don't get the readjustment. They pay no taxes.
They won't get a bill.
Yeah, they won't get a bill, it'll
Yeah.
be zero. So I appreciate your point about protecting low-income families, but I don't see how the HSRR is specifically related to the 200% exemption. I might be missing something.
Yeah, I appreciate your point about the protection up to 265% FPL being embedded in the household size rate readjustment.
In the future, maybe we can note that, like, if they're discussing, I mean, there's already a lot on here, but
But it doesn't start.
yeah.
Okay,
Yeah, 261.
so the committee recommended that we do include this. Is there
Could I
anyone?
say something about
Oh,
this?
sorry, I
Okay.
apologize. I've been missing Mike and Cheryl.
Could I just say something about that? So, just to remind you that the Finance and Revenue Committee voted on whether to scrap the HSRR kind of late in our time. And as I recall, some of us, including myself, did not vote to take away the HSRR because we were concerned about political viability with increasing the price tag by $1 billion, I think it was. But with this nuance that we just discussed on whether we use the federal AGI versus the taxable income, I personally would like to see a very brief analysis comparing what it looks like with the federal AGI and the taxable income scenario. I don't know if maybe Echo Northwest could do that for us. I just like to see the difference because that isn't something we discussed in the Finance and Revenue Committee. So I just like to see the differences there.
Yeah, I'm making a note about that. Mike, did you?
I'm sorry, could I just make a brief point?
Wait.
I apologize, Mike. Just to be clear, it actually, whether the HSRR is in or out doesn't increase the amount of money that needs to be raised. It just shifts where it comes from,
Okay.
because that's a big
Got
distinction
it.
between the
Yeah.
Medicare Part B.
Yeah.
So sorry, just wanted to
Okay,
toss
yeah,
in
that
there.
makes, yeah,
No,
thanks for that.
Carry on. Apologies.
I just wanted to bring up what I think is probably an imperfect analogy, but I remember 40 years ago, we had lots of debates within the health plan, and there was a whole school. So my analogy here is, think about 40 years ago, we actually had things called community rating, which I have not heard at all in any conversation here, versus community rating by class versus experience rating. Okay, I think the way in which our insurance has kind of de-evolved, because we have an incredible mess. And my analogy here is, and one of the beauties of the work you all have done over the last 2 years is you at least brought back values and ethics into the conversation. My analogy and my gut says here is, let's keep this as simple as we can. We've gotten so much into the weeds here, and maybe if we can think about what's the right thing to do, as opposed to what's the economic thing to do, we might at least have, just like community rating really was a better system than all the goddamn experience rating stuff, which just basically penalized people that were sick. I would say, if someone can think about this from the perspective of how do we keep this simple and fair and just, we'll probably make the right decision. Am I making sense?
Yeah, Michelle?
Can I just ask, Mimi, thank you for your clarifying point that it doesn't reduce or eliminating household sites rate readjustment doesn't increase the cost, but it shifts it. Can you help me understand where it shifts that to?
Sorry, because I'm trying to think about how I can bring up, there's a great graph about household size rate readjustment. And it does end up, I believe, shifting, I mean, it does shift the burden to slightly higher income earners, but that's, I don't want to make that distinction. I will go looking around for the graph and then I can show it to you.
Isn't it
It's
is it the Excel that's
1%.
in our material?
Yeah, it should be in the materials.
It's in the board materials, we can pull it up.
What's the? document
HSR
title?
exploration XLS,
Yes.
it's an Excel spreadsheet.
Let me try and I can see if I can
Oh,
pull it
yeah,
up here.
put
That's a
up.
great question. Oops.
Oh, yeah, it wants me to download it.
Yeah, because we don't have Office Suite on our iPads, so.
Okay, let me look here for a second. Okay, for the crux
I
move.
thought it increased HCPIT by 1%. That's what I recall.
It would increase the upper number, correct?
Mhm.
That is, I believe, what we have.
Right, and so when we talk about increasing the HCPIT by 1%, if we just round and say HCPIT is basically 10%. And so, 1% increase in that would basically take it to 11. But still, the
But the
effective HCPIT, 1% of 3.5 is 0.3, right? So it would take it from 3.5 to 3.8, right? So it'd be, so somebody who would pay 3.5% would now pay 3.8%. So it does change it, like we'd have to get more money from that tax, but it's a tiny amount, 1 billion. So 1 billion, again, we're trying to think of a $17 billion gap so the whole plan is trying to cover $17 billion. And 1 billion out of 17 billion is like a little bit more than 5%. Right, it's between 5 and 7% is how much everybody's cost would be up. You'd pay the 5 to 7% more if we removed it. That's how I think of it, like just proportionally where it's landing. A billion always sounds like a lot of money, but it's in the context of,
Yeah.
17 billion.
All right, so I'll just briefly share this. So this is from, thank you so much, Charlie. What this top one is, it says change in net healthcare personal income tax rate if the HSRR is scrapped. So cells that are in red indicate they would pay a little bit higher. Cells in green would pay lower taxes. So this is if it is scrapped, not if we keep it here. So you can see, and on the left-hand side, sort of in the blue and white, that is the income. So as we go down on the column, the income is higher.
This is the.
And then as you go
Yes.
across it says number of exemptions or number of dependents, I guess would be more appropriate. Right, Richard?
Yes.
Yes, okay, so you can see that people of slightly higher incomes with more family members would pay less if it's taken away. And those people with fewer dependents would pay more. So
People with zero exemptions pay more because they had zero exemptions, so the HSRR wouldn't apply.
I think because, again, because of the total shift of where the burden is, yeah.
Oh, got it, right,
So-
the total burden, so they would have to pay a little more to
Yeah.
make up for that loss.
Yes,
Got it, right, got it.
okay.
Yeah, so lower income people, pay slightly more at every level of dependence, whether they have zero dependents, 1, 2, 3, 4, 5, at every level. Folks in the slight lower income ranges would pay slightly more.
If only if they have, so again, if it's 0%, they're not paying anything. So it's only the folks in the red
Right,
that are paying more.
right, yeah, so I was referring to that like
That first column.
edge of, no, the whole slanted line of red that goes across all
Yes.
the dependents,
Okay.
yeah. Yeah. And then people within the slightly higher income will pay more. Or pay less, sorry. The green means they'll pay less if we get rid
Right.
of it. But slightly, right? So it's like
Yes, and you can look, if you look closely, yeah, you got to look at the
it's half of this,
percentages.
A percentage point or,
Yes, or 0.01% or so. it's, all right, I'm gonna stop sharing now before I blow up something. I'll go back to you, Lee. Thank you, sorry about that. All right, so, and I will say that this is in the final slide, but the Finance and Revenue Committee did have a vote on whether to take away the household size rate readjustment, and the motion did not carry, so it was 6 members voted to keep it as it is, and 1 member voted to scrap it.
Yeah.
Just so people have an understanding of what the Finance and Revenue
Yeah.
Committee
So
should.
to answer your question, Michelle, the additional money would come from people paying higher HCPITs, but only slightly, like less than 0.5% higher, HCPITs, that's where it would come from.
Thank you.
We don't want to stop the conversation, but can we aim for a break at 11?
Yeah, we're sooner than, oh gosh, yeah.
Yeah.
Let's,
Or by 11?
Want to make one more? I'm pretty sure there's not going to be a vote today, but we can get to one more slide here. Let's
Okay.
go on to the next one.
let's do one more slide.
Well, this one is relatively easier. The lodging tax add-on. Lodging tax is proposed to offset the cost of providing unreimbursed medical care to out-of-state visitors. However, I think people should recognize that the lodging tax actually just went up in Oregon. I have it on one of the slides. I think now it's, well, or once it's enacted, it will be something like 2-point-something% up from 1-point-something%. So there already has just recently, just tossing that out, there been an
And it was
increase.
a huge fight.
Yes,
And it would impact when Oregonians travel throughout Oregon.
Yes, it would.
Outside of their home.
Yep,
Yeah.
it
so
would.
It's not just travelers, yeah.
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 Absolutely. And if we want to go on to the next slide, just, I think we probably should take a break here because I think these two topics.
What I would propose is that, you know, we've gotten a really good sense of the priorities of the board, and we can try to come back with a couple of alternatives and explanations for the alternatives based on the discussion today, involving the taxable income versus gross, involving the HSRR, and then Medicare, which we didn't get to today, but we can sort of, you know, revisit
Or
those.
the EPT tax credit.
And then the EPT tax credit, yeah, and just talk about the rationale and show some examples of how things shift. If we change any of those, and again, appreciating the point of trying to take the whole plan as a whole. As opposed to, you know, like, you know, as we consider adjusting each individual part. But yeah, let's take a break. It's 10:54. We'll come back at
One more.
11:04.
But keep going. Yeah, so just so people understand when and where the board has actually made some decisions, I'm just gonna put that up there.
Okay.
So just for people to take a peek.
Okay, and let's come back at 11:04. Okay, we're gonna try and get started, but we do not have quorum yet.
If we can, I think next we're gonna start with Milliman, yes? So I think if they wanna, if you want, can't tell if Fritz, if you wanna pull up your slides,
Are Fritz and Ken both here?
let's see.
Yes, Ken and I are both on. I think Ken's got the slides.
Great, welcome. We will pass control over to you.
And you can just pull up the slides and we'll just wait a second till we get everyone back.
Not able to try to round up before.
Yeah, Fritz, I was going to just share. We don't have slides prepared. Fritz, I was going to share our report, and then just talk a few items here first.
And it sounds like you're cutting in and out a little bit.
Okay, can you hear me now?
Yeah.
Okay. This is from our report. Can you see this and can you hear me okay?
Yes.
Okay. So I want to just, I'm going to start here with talking a little bit about provider reimbursement opportunities, savings opportunities. So I think it would be, and then we're gonna have we have a couple more people. We have Andrew Noggle and Kate Shadell here to help us talk about some of the administrative aspects of and questions that you had of the plan itself. So I think it would help to clarify some context in our reports, in our discussion on provider reimbursements here in section 7.1. So for a quick recap and reminder of this section, because I don't know how, I assume everyone's read it or at least has access to it on the board here. But for a quick reminder, the expenditure estimates that we developed assume that provider reimbursement levels will stay at the same level in aggregate after implementation of the UHP. So figure 46 here in the report gives an estimate of current provider reimbursement levels as a percentage of Medicare schedule payments aggregated across the state. So this level of provider reimbursement is a simplified assumption. I think, as you've already discussed in other meetings and earlier in this meeting, that your reality is a little bit more complex than that. So because of these complexities, when developing the expenditure estimates, a full provider reimbursement analysis was outside of our scope. Additionally, the reimbursement schedule itself under the UHP is not yet designed and will eventually have to be set by UHP, by this board and policymakers, really. So as a result, we just haven't booked any savings in our estimates because they had not been defined yet. But that said, I know there's been a desire to understand potential cost efficiencies and savings related to provider reimbursement. So again, I'm gonna go a little further down, but section 7.1.2 discusses at a high level potential opportunities from provider efficiencies, and then section 7.1.3 quantifies a sensitivity analysis of those opportunities. So you see here, so the two estimated aspects of provider reimbursement that provide potential opportunity that we've estimated are collectability and provider administration. I believe collectability as a concept and provider administration have been discussed. So I'm not going to go into detail here for in the interest of time. But just real quick, based on status quo cost sharing estimates in 2032 and about a 50% collectability, this could translate into a 3 to 3.5 billion reimbursement improvement for providers. For provider administration, the UHP's single payer structure should, as you discussed, reduce provider administrative expenses, and there could be significant savings, likely in eligibility and billing. So again, taking a high level approach in review, when we reviewed a couple studies on insurance related administration, we estimate about 4 to 5 billion annual total for professional and physician services related to insurance admin. So what that indicates is a material opportunity for the UHP to provide savings from provider reimbursement. So these estimates are high level. We recommend a more detailed, explicit analysis once details are established. So we've presented these as potential opportunities associated with provider reimbursement strategy and not necessarily as a guaranteed savings. So just to contextualize figure 50 here, this figure shows that if those collectability and provider administration opportunities are fully realized through lower provider reimbursement as the mechanism, adjusted 2032 expenditures would move from, for example, 85.5 billion to 77.7 billion in the best estimate scenario. Our intent here is to illustrate policy sensitive opportunities that exist. And also, 2 paragraphs down, you'll see a practical benchmark there. So each 1% reduction in provider reimbursement, excluding prescription drugs, reduces costs of the UHP by about $500 million. So put another way, the right way to read this section is that we understand there may be meaningful savings opportunities, but they depend on decisions that have not been made at this point.
Yeah.
So
Can
it is, yeah,
Can I just add just a couple caveats too?
absolutely.
We go into this in the report. There's also the issue of timing. Most administrative savings don't materialize overnight. It's going to be dependent upon, for example, how legacy systems are retired. If they're retired, it'll depend on the the implementation schedule of the UHP itself. So there's a big timing element here in terms of, is this a multi-year savings? It almost certainly will not come in the first year. And then just to reiterate something that Ken says is that, and just kind of commenting on comments I heard before, a lot of our estimates here have to be more generalized because there was no specificity around the strategies that would be used to reduce costs. So we took the approach here to be responsive to the concerns that we could. We took the approach here of really pointing out that there is potential there, but that it is entirely dependent on the specific strategies, and then probably even more importantly, the actual execution of it. So I heard a couple comments earlier about the total number of expenditures, and we are glad to listen and got really good feedback from so many people. But again, so much of it is not yet firmed up, so we can't model necessarily what has not been decided upon.
Yeah, absolutely. Thanks, Fritz. That's all I had to say at this point. Should we turn it over to Kate and Andrew?
So can I interrupt, Ken?
Absolutely. Go.
This is Helen. Thank you so much, both Ken and Fritz, for being here at this meeting, first of all, but then also highlighting this portion of your report. Overall, your report is excellent, and we're deeply appreciative of the work that you've done. So thank you in general for all the work you did, and specifically calling out this section. And Ken, I just want to make sure that the board understands what you were just calling out here, because it's really relevant to the discussion we were just having. So based on this figure 50 here, what you're saying is that providers, meaning hospitals and ambulatory care centers with clinicians in it, are going to be up quite a bit of money if the UHP is fully implemented, specifically $3 to $3.5 billion in collectability, meaning they're owed these co-payments right now and they can't collect them, or they cost them a lot of money to collect them, and under the UHP they'll automatically get them. So that gives providers like $3 to $3.5 billion right there. And then in addition, because of the insurance admin costs, they might be up $4.5 billion because they're employing all these staff that they won't need anymore. And so the money, if we keep their reimbursement the same and they don't need to do those functions, that they'll be up that money, right? So total somewhere between $7 and $8.5 billion will be sitting in the provider's bucket, so to speak, that isn't there now. Is that fairly accurate?
Yeah, that's the high level estimate. Yes. And it's going to be I just want to add, that's going to be widely variable by provider. It's going to depend on the population that they serve. It's going to depend on geography. There's a lot of variability in there. This is so.
Yeah, I appreciate
that.
But when we talk about changes in our revenue plan, that may increase costs, increase our need for revenue by $1 billion. That would, if we did an across the board, reimbursement of reduction of 2%, every provider in Oregon has 2% less reduction. They're still coming out ahead in theory. I guess there's variation, but they'd still be coming out ahead, and we suddenly have $1 billion more in revenue to compensate for things like, you know, if we, the Medicare, you know, or anything like that. And then, you know, subsequently, a 4% reduction in provider reimbursement would get us $2 billion worth of revenue. So that's how, when we talk about administrative savings, we have to reduce provider reimbursement in order to realize those savings. But there's room to move here because this is what we estimate they'll be gaining by going to a UHP. And so if we say, look, if you take 80% of that instead of 100% of that and dump some back into the plan so we can do these other things to make paying for it more equitable, that would be really useful. So that's where some money would come from when we talk about adjusting our revenue strategy.
Yeah, right. And it just, right, that all tracks. And the mechanism for that reduction has to be through provider reimbursement. And there's even more, you know, some of this provider administration. We talked about it a little bit more on the professional, on the physician side versus, you know, on the hospital side. For example, there's just a lot of nuances with that as well. You know, just clarifying a like what a 1% or 2%, you know, reduction across the board. It's gonna impact different providers differently. I think is the point I'm trying to make through that. So just communication is important with that, and the providers are going to need to understand why why they're getting these cuts before they happen.
Right. And as I mentioned at the beginning of the meeting, it's gonna be a lot of negotiating, right? And there's no guarantee that that'll happen, but that would be the negotiation and likely play out differently, like you said, in different regions. Thank you.
Mike, did you want to ask a question?
No, I just wanted to echo Helen's comments. I think that this section of the report, I think is very useful as long as we do something with it. And I feel like I'm a broken record, but I think we need to do what Ken is suggesting. We need to do a more refined analysis. I'm not clear about how we're going to do that, but I would welcome a conversation about that.
Oh, Mary Lou, yeah.
So I think that just clarifying too on this with providers being everybody from the big hospital systems to individual small practices of providers, et cetera, that it really is very variable in terms of their ability and to kind of and willingness to maybe understand why this would be, and that it is not really taking it away so much, but it also has to do with, especially at the clinician level or the practice level of physicians and the provider, the payer mix that they have. And so that, am I correct that, you know, providers who have a heavily commercial mix mostly, would maybe feel this more than the ones that have many Medicaids and Medicares in there and a smaller proportion of commercial patients. So it, you know, and that's variable. And I don't know that when Judy was she printed some stuff that I want to go back and look at again about providers and what, you know, how many and what they're doing and that kind of stuff. I don't know if that data was in there, but you know, kind of how do we know about at a macro level about things like the provider mix? Clinicians.
Yeah, we don't know about payer mix. We don't have that information. She was talking about where they were employed,
Yeah,
which is the same.
no, okay, thank you. She had great data, and I just couldn't remember. Example.
Thanks, Ken.
Yeah, and I do think a study on this is very possible. With there's with your APAC data and with information that we transparency information. I think this can be tackled. It's just it would be extensive. Yeah, it require a lot more detail. I'm gonna flip flip it over to Kate now. Kate, you want me on page 18?
Yes, please. Hi, everyone. Thanks for having us again. Just wanted to quickly address some of the comments that were brought up during the board meeting last month. We know that you, sorry, I think it's a slightly different page, Ken. It's in section 4.4, just down at the bottom. Yep, thank you. Just know there were some questions about the overall staffing model. Wanted to draw your attention to sort of the text that follows this staffing table here. As noted in the staffing, you know, the ranges that are presented from low to high are really dependent on program design and your operational model. To Ken's point earlier, this could vary based on those final programmatic choices as they come through. We also don't know the impact of level of automation, Anthropic AI, what you decide to insource and outsource here, and how the care and medical management models are really set up. What we also added just slightly below that is we do not know the current state workforce in Oregon, but we did add 2 different proxy data sets here, just so you have an idea of what we're coming up with. One is the National Association of Insurance Commissioners, NAIC. We pulled some data from them that shows around 21,833 employees, and that number is specific to the private sector. It does not include all of Oregon's entire healthcare industry. It likely excludes the public sector, some operational technology vendors, and some non-healthcare insurance related establishments and employees. We also pulled from the America's Health Insurance Plan, AHIP, looking at their workforce data from 2024 to 2025. That number is around 14,400 health plan employees. That smaller number is just very specific to the Medicaid CCOs and Medicare Advantage plans and some commercial insurers. It does not include like the entirety of the Oregon Health Authority and Medicaid staff, Medicaid adjacent staff. So anyone doing sort of the eligibility verifications, administrative work and policy there, or any of those vendors that cover those enhanced services such as behavioral health and dental and vision. And so those 2 numbers combined are low estimates. So just wanted to put that in context in front of you, that our adjusted estimate around 15,800 does seem reasonable and fall at a lower employee number than the estimates we have now. And keep in mind that's projected into 2032 as well. So just wanted to circle back on that, and happy to answer any questions there as well.
Thank you so much, Kate. That's really helpful. Yeah, that number wasn't really quite a sticker shock, but this additional data is really helpful in terms of putting it in context. I mean, I know you're too professional to make a guess, but I would say probably upwards of 25,000 in Oregon right now is probably a reasonable estimate, you know, and so 15,000 in that context seems, you know, way more in line with what we were thinking. So I really appreciate the extra effort on this particular issue. I think it's really helpful to try and put it in context.
Sure, absolutely.
Any questions, comments for Kate or any of the Milliman staff? Oh, Michelle has her hand up.
Thank you, Chair. And thank you for this additional context in response to our board discussion last month. It's really helpful. I just want to put it on the record that I don't like the questions and concerns that I'm raising. And I think even as I read the minority report, I don't take it as a critique of the work of our consultants. I think, you know, we needed a starting point, and we didn't even know what the remaining gaps and questions would be or the further analysis that might be needed until we had something to stand on. So to me, I think this is a great starting point. My request is just that we be honest with the legislature and the public about it being a starting point and the ongoing work that will be needed to make it a real implementable proposal. Because I think if we present our starting point with all the gaps and questions as a proposal, it'll get shot down before we can even do that further analysis. That's my only point. So it's not a critique of the work that's been done by the Finance and Revenue Committee or our consultants. And I think it's also not a surprise to anyone who has seriously watched this process. I mean, I would just note that the governor in the signing letter for Senate Bill 1089 in 2023 cited concerns about the timeline and the resource constraints. So I think we've done the best we can with the time and the resources we have. And I just want to thank the consultants and the committee and make it clear that I'm raising serious concerns, and it's really about how we frame our work and not a critique of the work that's been done.
Thanks, Michelle. Anyone else with questions or comments for our Milliman consultants? Okay, again, on behalf of the whole board, Fritz, Ken, Kate, we deeply appreciate all the work that you've done. This is an excellent report, incredibly useful, and we're really appreciative of your expertise and your willingness to come to these board meetings and be a resource to us. It's been really great working with you, and we're deeply appreciative of what you've done here. So thank you.
We're happy to serve.
You guys are gonna miss us. I know it.
Thank you.
Thank you.
Okay. Mimi, do you want to do the summary?
Let's see, where are we at? It's 11:30. I think we could go through that really. Well, I don't want to give, I really want the community engagement and communications to have a chance and
Yes.
transition. So if there's time after that, I'll go.
Maybe when we get to future topics.
Yeah, perfect.
Yeah, let's do that. Okay, so let's go to committee updates then, and we'll start with community engagement and communications.
Michelle's gonna do it today.
Michelle, you're up.
Thank you, Chair. And hello, board and members of the public. Michelle Glass, her co-chair with Amy Fellows of the Communications and Community Engagement Committee. Quick report on the focus groups that we spent all of March working on. Thank you, huge thank you to Mimi, Isabel, Lee, the whole staff team for all of the extra work, and of course, Artemis Consulting and Wentz Jackson Consulting. It was an all hands on deck, 7-day-a-week type of process, and we're really excited about the results and excited to share those with you at our special board meeting coming up in early May. So the Cliff Notes version is that we did hold 11 focus groups in March as part of our strategic engagement plan with Artemis Consulting. We do have one more focus group that is still in the planning phases. We have been able to chat with all of the groups that were on the list. So really excited to have had engagement from every single group that was on the strategic engagement list. And I would say the quality and the detail of the feedback has been really exciting to see. So a full summary of the findings of the feedback is being written as we speak by Artemis Consulting. You as board members will receive that report on May 5th ahead of our May 12th special meeting, where the report will be presented and you'll have the chance to ask questions, and our consultant will be there as well to support that process. So more to come, but just want to say thank you to everyone who drafted questions, sent us organizations or contacts to consider, and of course the members of the public that participated in those focus groups. Another quick note about this phase of the work. Now that we're doing these focus groups, and as was mentioned earlier in this meeting, we did send out a summary of the draft plan as it stood at the beginning of March. All the numbers that we had, all the plan details that we had at that time was sent to all focus group participants ahead of those focus groups so that we could get their feedback right on those drafts. And now that the focus groups are over, that document is included with the board materials for this meeting. It's publicly available on our website, and it will be also posted with the CECC meeting later this month. And I know that some external groups like Healthcare for All Oregon is also sharing it widely for some of their outreach, like the town halls that are happening in April. What that means for us is more public scrutiny, which is good. I think that will facilitate more public comment that's specific to the questions we are wrestling with. And it also means that there may be more media inquiries that come to the board. So I did just want to take the opportunity to remind the board of our board adopted policies. They're going to be really important in this more public and more visible phase of the work to protect the work of the board. And so the media inquiries portion of that does state that board members must not speak to the media about the Universal Health Plan Governance Board or its work. And all media inquiries are to be forwarded to our official board spokesperson. Thank you, Mimi, our fabulous executive director, immediately. And it's distinct from our other board policies about external presentations, where it says that board members can speak as individuals, not formally representing the board. With the media, it's actually just board members don't speak to the media about this work, period. That's what the policy says. And that's by design, because most likely if a board member is being contacted by media about universal health care in Oregon, it is because we are a board member. So it becomes kind of meaningless to say, I'm just speaking as a regular person if we're being reached out to because of our involvement in this really important work. And we're in a very sensitive period of the work where that's going to be important. So I would just encourage any board members that have questions about that to reach out to Amy and myself, to Mimi, but I did just want to remind board members of that. Similarly, if you are involved in public outreach right now, such as the town halls in partnership with Healthcare for All Oregon, thank you. And there are many resources to support you. So we have updated slides, we have, we're happy to provide you the most updated one-pagers, et cetera, for any outreach that you may be asked to do. And then just a reminder that if you're doing outreach, we all as board members per our policy do just need to loop the executive director in so that it can be tracked and we can make sure that we have provide you with those materials. Finally, just a reminder to the public of our extended public comment period that the Communications and Community Engagement Committee is holding every single month. So it's from 5 p.m. to 6 p.m. It's an entire hour, and individuals are given up to 5 minutes per speaker to share their thoughts. And then we, as a committee, take those comments, consolidate them, bring them to the board, and bring them to the transition committee. So our next meeting is Wednesday, April 22nd. And if anyone would like to provide public comments, they can register on the website. It's very clear at the very top of the Universal Health Plan Governance Board website. And the registration is needed 72 hours in advance. And you can, of course, also submit written comment. So those are our updates. Does anyone have any questions? And Amy, did I miss anything?
I think you got it all. And Cheryl has a question here.
Please. Thanks, Michelle. I heard you loud and clear that we as individual board members do not respond to media inquiries. And I'm wondering if there's, and maybe this is beyond communications, but are there any parameters for board members talking with legislators, state legislators, given that there will be a report going to the legislature, and there will be certain legislators who are chairs of healthcare committees who I assume will be helping move forward a legislative concept. The reason why I ask is, for me, the 27th session is basically started already. So we are talking with legislators, we're working on legislative concepts. So I just want to have really clear guidance on our own communications individually or as a group with the legislative body.
That's
Is that a communications issue?
It's a great question. I don't think we have a specific portion of our policy that relates to legislator engagement specifically. What does maybe apply is the best fit for what you're, I think, asking about is the general guidance we have for informal conversations with colleagues, community members, or other interested parties, where our policy says that board members should be really clear that we are not, unless the board formally votes at a meeting like this, to appoint a fellow, one of the board members to represent the board, none of us are authorized to do that. So that's the first thing. So we have to be clear if we're having informal conversations, you know, whether a legislator calls you up or your neighbor is talking to you, or you're talking to a coworker, that we are not representing the board officially, that we keep confidential and speculative information private. If we're asked questions that the board has not deliberated on or made even a kind of draft decision on, that we not give our own opinion as speculation, that we say the board hasn't made that decision yet. Maybe here's what we're considering. And that we be really clear about the distinction between proposals under discussion, say at the committee level, and decisions that the board has made, just so that we avoid confusion, which is going to be constant struggle, I think, in the next phase of the work as this becomes more public. And then if there are questions that you're unsure how to answer, maybe it's a question about work on a committee that you weren't a part of, those can always be forwarded to the executive director.
Okay, thanks.
Thank you, Michelle, for all that clarification. I really appreciate it. I do think we need a specific kind of policy about talking to legislators for a couple of reasons. One is that this is like Cheryl just said, the entirety of this work hinges on the support of our legislators, and having a unified message and a clear message is going to be really key. And we don't have enough of the details of the plan worked out to start talking to legislators. The one message that is absolutely clear is that our report will be delivered in September. That is non-negotiable. That is an absolute. We are delivering our report in September. But beyond that, what the report contains is still the work that we need to sort of agree on in the next few months. In addition to that sort of logistical piece, there's also the piece about this board exists within a state agency, DCBS. And the rules for lobbying for state agencies are a little different than they are elsewhere. And we need to be really, really clear on what those rules are and how we lobby and how that can happen. We are not individual citizens. We are part of a state agency. And so while we can lobby legislators as a board, there are rules about how that has to be done. And we have to, think about if we need to register to do that. So before anybody talks to any legislators, we need to do some work with the staff on clarifying how that process works. And then we will be addressing that in more depth beginning in September. But between now and September, I would ask that no board member speak to any legislators about this work until we clarify some of those regulations around lobbying specifically, and then getting our plan a little bit more together. Does anyone have concerns about that request? Yeah, go ahead.
I do. I have been very active legislatively for many, many years. I have many of these legislators who are friends, or I met their, helping them, whatever, as a person, on the fundraising, or whatever they're doing. It's very hard to just simply say, I can't talk to you about that.
Why?
Why? Because they're asking me questions, knowing that I'm serving on this thing. Now they can watch the TV thing, but they don't have time to do that.
Yeah.
And so I think I'm very careful to say, just the kind of things that you're saying, but I don't know. To kind of have I can't say anything.
Just say the board's not prepared to discuss the details yet. We will have a report in September. You could say that. But beyond that, we're not ready to discuss details, but we're putting together a communication package for legislators, and we'll be very eager and ready to talk to you in September.
Okay.
Michelle has her hand up again.
Go ahead, Michelle.
Thank you, Chair. I do think that these distinctions are really important. And getting clear definitions of lobbying and the restrictions that we must operate under to protect the integrity of our work while we're embedded in a state agency serving as governor appointees, I think is really important. Two things I just want to clarify. One, I think what I hear you saying is that this is questions from legislators related to our work. So if the legislator wants to talk to me about affordable housing, or, what have you, like, that's fine. It's just, it's related to the work of the board is one thing I just want to clarify. You're not saying board members can't talk to legislators. It's just, we can't talk to legislators about the work of the board. Is that right?
Of course, yes, absolutely.
For sure.
And the second thing is, I just want to name that many of the public events that board members are speaking at also will have legislative members speaking. And so we will be in settings like these town halls where by design, Healthcare for All Oregon has invited local legislators and members of the board and will be co-presenting or sitting on panels together. So I just want to name that. And if the staff would like any support from CECC in drafting up an addition to our policy, I stand ready and I'm happy to do that.
Thanks, Michelle. Okay, anything else from CECC? Go ahead, Mike.
Yeah, I appreciate the perspective of trying to be very careful. I also appreciate the perspective that, I mean, there are legislators that call me up and ask me things, and I do have conversations with them. I do describe, different international models on such and such. I don't believe by having those conversations that I'm breaking any rules. I'm very clear that this board has made very few decisions so far, and that we're still in process. But I don't think it's very wise if somebody calls Chumway or Amy or the like, and they're trying to get grounded more, that we can at least make some suggestions or frame some issues for them. So I think we need to be very careful here about getting so controlling that we're can't with the best of intentions, we're subverting our own effort, because people do not know what the hell's going on. It's clear from a lot of the public forums, people don't know what's going on, and yet there are these other public forums that have been out there, and it puts all of us in very awkward, almost no-win position. So I a little bit of control I think was fine here, but trying to then come off as if the bureaucratic no comment stuff, I don't think that works anymore.
Yeah, go ahead, Michelle.
Thanks, Mike. I understand that concern, and I don't hear that being a proposal. What I hear is a pause, because we haven't, we're a brand new board, right? And this is a new challenge that we hadn't thought through before, and we just need to check all of the relevant rules before getting ourselves into trouble. I know that, DCBS has an official process that they must follow, and our board must follow, and the executive director is our representative in that, in advising or requesting budgets for our work through the legislature, and that the governor's office is involved in that. Circumventing all of that can have repercussions for our work that I don't think any of us fully understand yet. So what I'm hearing is a pause while we clarify, bringing that clarification back to the board, and then deciding from there what we do. And I agree with you, no comment isn't helpful for anyone. What we have is an official board representative, which is the executive director. She's already looped in with the governor's office, DCBS. She's already working on the policy option package for the 2027 session. So it's really just, that's a great question. I would love to connect you with our executive director, Mimi, to get an answer to that. So I don't think we have to shut people down. I think it's just about, while we pause and check and make sure we're not harming our work, which, do no harm is one of my highest maxims in this work. We just refer questions to Mimi, and then we revisit this conversation. Does that seem reasonable?
Michelle, can I say something? For example, and I think it was brought up as an example, at the Portland Town Hall, Travis Nelson and I are sitting there, and I'm giving the presentation from the board, our slideshow. And, afterwards, Travis and I are just having a conversation about all the pieces that still need to be done, or, whatever. I didn't say anything, I'm trying to think, but it was just this kind of like, when you're in the room, with these people, and I'm not about to take myself out of the room, I can't, in terms of, Representative Tran. I go to her Pizza for the People on Friday nights, and she always goes, Mary Lou, can you give us an update on what's going on with healthcare for all and for the Universal Board? And I say, I can't speak, on behalf of the whole board. I can tell you that you can give comments, you can go to the website, you can whatever. We are, considering a variety of options. That's, something kind of vague, but if that's kind of like that, I'm not supposed to do that, I think that would be very hard.
So I think there's a difference between a legislator approaching you and saying, how's it going? And you're
Yes.
saying, it's going great, we're on track, we're
Yeah.
gonna have our report ready in September. We've got these great consultants, our consultant reports are in, our committees have wrapped up, we're on track. Absolutely, you can give updates like that. I'm not saying you can't. I think there's a difference between a representative or a senator coming to you and asking
Yeah.
you for an update and you actively going to their office or contacting their office and making suggestions about what you think should happen
Oh, no, okay.
with our funding,
Yeah.
with
No.
our timeline,
Mhm.
with the plan that's going to be in place. That is a really
Mhm.
different thing. That is completely a separate thing. If you actively go to them and say, I think this should happen instead of what's on the table. Don't do that.
Yeah.
But certainly be polite, answer questions, give them updates on our work. Anything that's in our presentation is fair game. If they're wondering how it's going, you can say it's going great and we're going to be on time with our report in September, right? So that's the distinction we're trying to make, that lobbying and asking for certain things from our legislators is different.
Yeah.
And yeah, that it's really easy to slip into that inadvertently. So I would just caution you against that and make sure that we're clear with what our role is.
The advocates.
Okay, anything else about CECC? Great, thank you so much, Michelle and Amy, and we'll go to transition committee. Judy's not here, so Mike, Mimi, who's gonna give an update?
I don't know. Do you want to speak first, Mike? And then I've
Yeah,
got a
just
couple of things. I'll kind of go over
a
the
couple of things.
work.
First of all, I think the transition committee has clear work plan. I think we're gonna be able to do the work that's required. I do think that we are trying to get clear on what does the transition committee do, and then what does the board do? And I'll go back to a comment that Mary Lou made, that, we're hopeful that we can get this work done, but without some additional analysis, like Ken was saying, I mean, we'll have it, but will that be good enough? I urge us to figure out a way to complement some of the transition work, either at the board or in some other way, and I would leave that to Mimi to best figure out. But I think we've got to do a little bit more, because without that, we have essentially now a public report saying it costs such and such, and this will cost way more than if we just kept the status quo. And I think for not only offensive, but for defensive reasons, we better come up with a solution to that. I'm not suggesting it needs to be done in the transition committee, but as a board, I think we've got a real challenge there. With that, the staff has been doing, I think, some marvelous work in terms of helping think through the transition. I particularly want to compliment Lee's work, trying to help us think through all the different permutations that are going on. And I'm certainly learning a lot from Lee. I'll now turn it back to Mimi.
Thank you. what I'd like to do, just briefly is go over some of the agenda topics and then sort of the order which the transition committee has it set out, and you'll notice that on the next, but here's some of the topics. They're not in any particular order of importance, but just so, of course, the main topic would be, is the second bullet point, implementation sequencing. In other words, how do we get to where where we want to be? So that, of course, is the biggest point. However, other things that will come up into it, including that will be evaluated, as much light shown upon it as possible, as much resources that we have put towards finding great answers to these questions. So included in that is the work, as we mentioned, on administrative costs. There's some governance work that just needs to be sort of lined up for the board to make decisions on. There is a very large gap that we have right now, which has to do with the information technology, any type of system and what we have, you'll see underneath some of these topics is the word scope. Because obviously we do not have, you could literally spend years, and people do, and hundreds of millions of dollars trying to figure out the perfect information technology system that could run all this. Clearly, we don't have those resources. However, kind of within that, what we hope to do within that scoping is understanding the questions we can answer in the limited time that we have and the resources that we have, and understand the outstanding questions that need to be addressed. And even, as I've said, framing up some of those questions is critical. And maybe they won't be done before the report, but maybe even some of them will get done before the end of, the biennium. So it's not like we're all going to stop work on September 15th. Other things include the financial portion, transition, a larger engagement strategy, system readiness, then of course, workforce transition. Now I have cost saving measures that is very broad, but I want people to understand that also one of the major, if you look at any of the data about how universal health plans save money, frequently in the literature, it has to do with savings around prescription medications. So that certainly it is not going to be, it's not a subject that's going to be left behind, but we'll do as much as we can. So if you go on to the next slide. So just so people kind of have a sense of how we're laying this out, and then if I think we'll have time, actually, I'll be able to kind of go over potential for our board meeting agenda, but this is what the way that we've set it up for the transition committee. And I put in there when the board meetings are. So, the transition committee really, their work is to inform the board to the best of our abilities. And you can see implementation sequencing is very high up on the list. We've also tackled the first portion of administrative costs. Most of them are set up as there will be one meeting where there will be an informational meeting or informational and a scoping exercise. And then at the next one, there will be some decisions made about if there are recommendations. It may just be, just pass all of this information along to the board, or no, this committee believes that this or another is based on their opinion is the right way to go. So if you'll just notice where it says in bold the decisions. Now, one thing that's a little tricky, if you will notice, is that the second meeting of the month is only a week before the board meeting. And so what we will end up doing, any decisions that are made in those meetings, do our best to email them out the same day or the very next day to the board. So the board will have all of the information as much as possible. So if you go on to the next slide.
Maybe just a little process interruption. There is.
Yes.
I want to think this out loud with you. Since we're gonna have a board event for getting communication, and we kind of delayed a decision today regarding the elements. I would hope that maybe we could find some portion of that time to continue to make some further progress on our most outstanding issues. I'm just making that as a suggestion, because we really do need some more board time for discussion, and we need to make some decisions.
So you're talking about the May 11th or the May
Yeah.
whatever meeting?
Let's
Yeah.
focus on the focus.
It's on the focus.
It's the entire, we only have, yeah, it's,
Yeah, the May 11th meeting is only about.
Okay,
and we pulled that out so that we didn't have to try to shove it into a board meeting again.
I just
Not
wanted
do that, but, yeah.
Yeah, but your point's taken, Mike. I
Yeah,
get what
but I
you're
think
saying.
that
Like
we did
when,
have a suggestion that we may
Right.
need additional.
and as soon as
focus meetings.
we get to then, we'll talk about
Okay.
the options there. Yeah.
All right, so just again, I wanted to make sure that the board was clear about how the transition committee topics. Pretty much the order is how that we've laid them out have to do with helping the board, informing the board about decisions when there are some sort of decisions that need to be made sequentially. So that is the way that we have set this up. And I think I wanted to talk a little bit about just has to do with transition committee, but about how the general process, if a committee or the board feels that there is a need for we'll just say a consultant, for lack of a better way to put it, to solve a particular problem and that funds are needed, the best way to bring about that, you'll see at the beginning of all of the committee slides, it usually says are resources needed. So that is something that if it is either brought up at the committee level, and then it needs to come in front of the board, obviously, the reason I give the budget report all the time is to let people know the amount of funds that we do or do not have that's available. But I wanted to say that before something is embarked upon, like asking people for a large statement, a statement of work or things like that, that usually this is a decision that comes here. So the board can all weigh in on the advisability of it. I am thinking if, I just want to pause if there's any other transition committee questions, or Mike, if you wanted to add more.
No, I think you did a good job. Thank you.
Okay. I think if you could, I don't know where this, right after the break, if you can get there, Lee, and I'm just gonna go up to a little bit, since we're talking about proposals, and I think we have a little bit of time, I wanted to make sure that we didn't shortchange CECC, but I would like to talk about board agenda planning in a similar vein to how I was doing the transition committee. So first off, we'll go to the next slide. Kind of get the board recognizing all the work and the decisions that have been made. And on if you look at the right-hand side, pending board review and or decisions. So if we look under governance and administration on the left-hand side, you see the things that the board has already looked at and has done and is will be putting into the final report without significant amount of other revisions, but it of course will all come first to the board. But on the right-hand side, there's a couple things that are going to go in front of the transition committee, which is like a discussion about a universal health fund board composition and board appointment and rulemaking authority. So some of those types of decisions. If we look under operations things, we have on the left-hand side, the work that has been put in front of the board or approved. And then on the right-hand side, some things that still need attention to. All of those also operational workforce needs have actually been looked at, but it hasn't kind of been a sort of a final decision or discussion about how the board would like that to be in the report around the discussions around operational workforce needs. And then of course, IT, ODHS readiness, because they are an agency which is would be closely involved with the universal health plan. And going on to the next slide. All right, and same thing for all of these things. So you can see things the board has looked at, elements that are going to come in front of the board that we have time to, that the board again has time to review. See that financing structure, there's a lot there still. There's certainly a lot that's being looked at, but more to come. If we go on to the next slide.
Can I back up one second?
Please do.
So on those where it's really helpful to go like what we've already decided and then what's pending. I just want to point out to the board that the pending items are things that we could either decide are important enough to take up and make a decision on, or we could indicate in the report that we recognize these are important decisions that we don't have the capacity or time or resources to decide. That these are things that would need to be worked out sort of in the coming biennium or in our future work. So things like on your first slide, like the composition of the governance board, I'm gonna guess we're not gonna get to that.
Oh, you
But-
never know. I don't know, technically.
But, and, well, I mean, you know,
But
there are
yes.
issues like that, and so we could say, this is a decision that needs to be made that we are not going to make, but you know, that it's just listed as we recognize that it's a key decision.
And I mentioned this to you, and I was gonna ask, I want to recommend in the report that one of the board seats is from a disability-led organization and or somebody with lived experience with disability.
Yeah.
And so where do I bring that?
So exactly, that is, sorry, because now I can't, I don't know where my, I will let you know when, because that board, actually, I think is it coming up next?
Sorry, we're talking about two different boards. You're talking about this board.
Yes.
Yeah, and so there.
Oh, I'm sorry, I was talking about, well, the
You're not talking
future
about the
board
future
over.
Board that's gonna
Oh,
run the
no.
UHP.
No, well,
Well,
absolutely.
okay, okay. So I just want to
That's even
clarify,
more.
like, they're just two different boards that are
Yes,
in the conversation,
both.
and just to clarify.
Both.
Okay.
But yes, I think it's, I'll let you know. So I think it's the next transition meeting that we're going to talk about it first, and then we'll get more input. So
Okay.
I will keep you posted.
Yeah.
Thank you. Sorry. Discombobulated. Yeah, let's go jump ahead again to potential. Okay, this is very a draft of what board agenda topics could look like, but I'm sort of, as I've done the work for the transition committee and setting it up, this is the potential way that we can get through the very important questions that the board still needs to address. Now, you will notice in under italics, just, I didn't really want to sneak it in there, but I did sneak it in there a little bit, you know, considering an additional meeting, especially towards that end of July, we may, you know, that may need to happen. My other portion that I wanted to let the board know is that we've been working on the framing up the report and an outline, and that will, and we're, you know, working with board leadership and also with our consultant about like what the outline will look like, and that's going to come in front of the board at our next board meeting. And then every time, you know, we'll bring more to the board drafts of the proposal. So you all aren't like all of a sudden on whatever, August 15th, have to read however many pages. So just so people know how the way that we're setting this up. So if you know, just want to kind of take a second and look at that, I know there's a lot of large topics there. But this is just how we have it laid out so far. So any thoughts, you can get back to me later, or if you have things that you feel like, wow, there's something really big that's missing, I want to bring it up.
We feel certain that the LRR report will be available in May.
Oh, just LRO initial report. Yeah, actually, I think we do. Not certain, but
And
pretty.
just based on the discussion today, I think, you know, I think May is gonna involve, going through different revenue scenarios, I would say.
Yes, I make some
Right.
changes after today's meeting.
Right, and then probably in June, there'll be some reconciliation, some considerations of levers, you know, like if we land on something that doesn't quite line up with the strategy and we need to pull some levers, either, you know, provide a reimbursement or, you know, benefit design or the thresholds for when things apply. I think we should guard some time in June.
Yeah, I think we may need another meeting actually on
yeah,
all
I do
that,
too.
Yeah.
given how long that takes to discuss.
Right, and so, one idea is, we can set up another meeting if people are available for that, for discussion, but I would also like to recommend that, we outline some alternate scenarios for how we structure the revenue strategy with explanations involved of like advantages, disadvantages, and winners and losers kind of situation as a written document, and ask people to commit to reviewing it in advance. I think we can spend 5 or 6 extra meetings going through all of these and still not
Yeah,
quite
that's
feel totally comfortable. So if people are, you know, if we prepare some written information about, here's how you could do it with this, here's how you would do it without it, and what that would affect, you know, and like, you know, kind of a detailed document, and if people could commit to doing some homework before the next meeting and really reading through a detailed revenue document, and then having a special meeting, I feel more in favor of that. I'm not able to do like 5 extra meetings. I could probably do 2. But yeah.
Yeah.
Does that seem reasonable?
Mhm.
I think the more prepared we are when we come to the
Yeah.
meetings, the better the discussion goes, and there'll be, you know, because the extra meetings are probably only an hour, which isn't a lot of time to answer sort of the basic questions, you know, hour and a half. So yeah, so we can get an extra meeting probably in there in between. Wait a minute, would it be between May and June? Our current one is May 12th, and then
June.
May 21st is our board meeting, so between May 21st and the 3rd week of June, so maybe like early June, it would be an early June meeting before our June board meeting. To do like revenue strategy sort of levers conversation with a written document to review before that. I see
That
Carol
makes-
nodding.
that
How's
makes
no
sense
feel?
because
Yeah,
that,
good. Okay.
the Echo Northwest final report will be
Mhm.
done next meeting, well, the big meeting, May. So that's good timing.
Yeah, Echo Northwest report will be done, so we can review that. Yeah,
Mm-hmm.
okay. Anybody with, you know, I want to make sure that when we do extra stuff like this, that everyone's on board with it, because it's a bigger commitment than you signed up for. So just Michelle, Mike, Chunwei, are you all okay with an extra meeting in early June?
Absolutely.
Yeah, Michelle, I see you nodding. Okay. Okay.
Can I make one other process suggestion here that I really appreciate and totally support where Mimi's going with this. I also think there will be some work to do after a report stuff, and we need to begin to think about that as well. So, for instance, if we feel that some additional work needs to be done to further ground our assertions about why X plan should work for IT or for pharmaceutical or for administrative savings, I suspect that this is going to be an iterative process. I mean, one of my learnings from being a part of groupings like this is that people make a big deal about the quote final report stuff, and the most important things I've noticed aren't really necessarily the things in the final report as much as has this engendered something that's going to result in some community dialogue that say, yeah, let's get behind this, let's create a movement versus, oh, let's put that report on the shelf. So it's not too early to begin to think about how we position some of that, and the biggest issues there are ironically the ones that Richard said today. The IT, very complicated, not just regarding the health fund, but regarding the entire structure. The pharmaceutical stuff, just, that's a mess. I mean, we don't have a state strategy yet on that one. And so I think there's a couple of, and then what is going to happen in terms of the Medicaid program short term, that shoe really hasn't dropped yet. That's going to obviously change some of our financial analysis. So I'm only saying, let's begin to put some placeholders on some future work. And I say that because then you got to put that in the budget for not just going up to next June, but beyond that. So anyway, thank you for your work.
Thanks, Mike. And you just reminded me of something. When we were doing board updates at the beginning of the meeting, I forgot to mention that Dr. Bruce Goldberg is going to be rejoining the board in July. And the reason why that reminded me of it is because he's on the task force that's considering the impacts and the changes that are going to happen to the OHP plan. And I wonder if in July we can have him give a little update for us on what the recommendations to the governor were regarding that.
As well as welcoming.
Welcoming him back. Yeah, it'll be great to have him back in July. Yeah, go ahead, Amy.
If people want a preview sooner, I was asked to meet with these students from liking on the university now. Ivy League back east. Anyway, the OHA commissioned to give recommendations on the work requirements piece. So I can share that. It's public document, but
Good.
I got early access since I was part of the conversation.
Okay. You'd like. Okay, that was it for me.
Excellent. And I think we decided there's no. federal
Correct.
state
Yeah,
costs.
sorry, we
Yeah.
took that out of the agenda, so.
Great.
Yeah.
So I would say, aside from what we just discussed with Mimi's agenda planning, are there any future topics that we want to make sure that we cover that you feel like you need more information on? Yeah, go ahead, Chandler.
I might have mentioned this last time. One of the important future topic, it most likely will be a continuous conversation, is to continue to explore what will be the potential saving for single-payer universal health systems. So far, we focus mostly on administrative costs. Administrative costs is a big chunk of it, but not the totality of it. And a good example to compare would be Canada. Up till 1970, Canada had exactly identical health system like US. And up till 1970, the per capita spending, annual per capita spending were almost identical. But 1971, Canada implemented universal health care. Since then, you can see this historical trend. The two countries' per capita spending started to depart. So there's a system-wide go beyond administrative cost saving, differentiate Canada and US. Also, Canada is the only country together with the US that's predominantly having an open hospital system, meaning private practice physician can bring their patient into hospital. Outside of these two countries, the norm is closed system. Private physician cannot bring your patient into hospital unless you have an appointment. So that's so-called closed system. That's the norm outside of these two countries. And so in terms of comparison of operation, despite Canada had universal healthcare, the other parts still operate the same. So Canada probably provide a good lesson. And I will share this article with you. Yesterday, I was trying to search the latest comparison. The latest comparison is 2017 on administrative costs. And this analysis put down to the per capita level. So for example, in 2017, on the per capita level, the US hospital administrative cost is $933 per person per year. Canada, 196. On the physician administrative cost related to billing, US is $465 per person per year. Canada, $87 per person per year. And they also compare the overall administrative costs. For US, the interesting comparison is Medicare traditional plan, 2% in that year, administrative cost. That should be a helpful reference. For Canada, the nation as a whole, 1.6%. That should be a benchmark. And similarly, on the physician administrative cost, in that year, in US, it was 21.8% of their total revenue. 21.8% of US physician, maybe private practice or group practice clinic. Canada, 10.89%. So there are more data. I can share this article with you. So that's an important reference. And so we need to think broadly. Yes, administrative cost is a big chunk of it, but not the totality of it. There's something in the universal health care go beyond administrative cost that separate Canada from US since 1971. And we need to explore what else. For example, I mentioned about the capability of leveraging payment, the capability of procurement of not just pharmaceutical, but also technology, the capability of reducing redundancy of technology, redundancy of utilization. There's a whole range of them that we need to continue to explore. Because this is vital for us to reduce our total projected cost to make it viable. Otherwise, I don't want our whole plan after we work for years to suffer, I call it premature death because of the cost.
Thank you, to share that, would be great.
And Princeton was who OHA, yeah, a professor and his graduate students had did this report. Work requirement suggestions. Yeah. We'll send it to me to get shared out.
Thank you. Any other recommendations for future topics, things that we need to cover at the board meetings? Information for the staff to gather to help us make our decisions?
I don't know whether, I'll just throw out the discussion that was early on and we talked about, but a lot of questions have been raised about eligibility in terms of people who, you know, travel to Oregon or, you know, those, I don't know whether we need more thought or discussion on.
There's a pretty robust eligibility proposal that has been approved by the board.
Right. but I
So
think
if there are
I'll go
specific,
back and look at it, but it seemed
Yeah.
to me that there were still people raising questions in these town halls, et cetera, that I,
oh, okay, mhm.
you know, I couldn't kind of answer.
Okay,
so I
okay,
need
yeah,
to-
if you want to look
need
at
to
it and then
read through it.
see if that prompts
Okay.
questions, and absolutely.
Anything else?
You know, I feel good about today's meeting. I feel good that we've had, you know, some debate, some questions that we're struggling with some toughness, but when I go back to, for instance, the one decision we might have made today, it confirms to me that I think we're looking at the right thing. So who knows? I predict we might even make some decisions next week.
Yeah.
I think we're getting there.
Any other thoughts, comments? Okay, let's go to public comment. So I have 1, 2, 3, 4, 6 people on the list. Isabel, do you have any of the 5? None of them. Okay, then I guess it's Colin Stackhouse.
Sorry. Hello, I'm Colin Stackhouse. I work with Healthcare for All Oregon. And I just want to, do I get 2 minutes?
Yes.
Great.
sorry, it's fine.
No, you're great. I just want to spend my time acknowledging the governance board members who are volunteering extra to spend time with our nonprofit participating in these town halls. So I'm just going to acknowledge the ones who are upcoming and sort of spend the time for the public, letting them know about the future events. Today, Thursday, April 16th at 6 p.m. at the Hillsborough Civic Center, Mary Lou Henrich, Chun-Wei Chi, and Mike Leahy will be participating in the Washington County Town Hall. This Saturday at 1 p.m. at the Silverton Grange, the Marion Polk County is hosting their version of the town hall with Mary Lou. On Sunday, the 19th at 2 p.m. at the Unitarian Universalist Congregation of Eugene, Mary Lou and Amy will be participating in that town hall. And I'll be down there personally, looking forward to seeing some of those people in Lane County. On Tuesday, April 21st at 6 p.m., we're having our only completely virtual event, which will be, I believe that Chun-Wei will be at that one, along with Mary Lou and Mimi. Very excited that you're able to participate, and Mimi's going to give the governance board part of the presentation. On Saturday, April 25th at 1 p.m. at the Trinity Episcopal Church in Bend, Mary Lou and Michelle Glass will be participating at that town hall. We're glad that you're able to make the drive, and Michelle, you too. And then on Sunday, April 26th, our last in-person town hall will be at 12:30 p.m. at the Medford Library. Michelle Glass will be there physically doing that part of the presentation. So I'm grateful for all of you spending the time there. I want to also mention that our Healthcare for All Oregon annual conference is on Saturday, May 30th at Portland State University. So hopefully some governance board members can come, but we hope members of the public can come as well. And the last sort of event that we're excited to host is next week, a week from today, Thursday, April 23rd, we're having a conversation about Vermont's journey and the successes they had and their obvious lack of success. And so that's with Dr. Deb Richter, former president of Physicians for a National Health Program and the current chair of Vermont Healthcare for All. Thank you.
Thanks, Colin.
Yeah.
Okay, so just as a reminder to the board, we have a special meeting, May 12th, 9 to 10:30. It's entirely virtual. So please keep that on your calendar, and public, of course, is welcome. It's of course a public meeting. And we'll be just reviewing the feedback from the interest groups. The report from Artemis. Please look in your email a week before that, around the 5th, for that report, and please read it in advance and come prepared to discuss it. And then we'll have our regular board meeting May 21st here, same as always, and then we'll look into setting up a special meeting in early June.
I just have a question about the report that's gonna be coming from Artemis. I'm hoping that it's going to give us, you know, all of those groups, and you said that they all responded, so there were focus groups from the 8 different, okay? And then, but kind of feedback that will be specific to this group. This was kind of their feedback, and that it isn't just gonna be totally a summary, but I'm interested in especially the provider people, since we've been saying that we really want to hear from them. I'm hoping that we'll be able to tease out. Do you know if that's the case? I'm assuming that would be it, but
I don't think any of us have seen it yet.
I mean, we've
But
only
Michelle,
seen the
what-
outline so far.
Yeah, we welcome your questions at that meeting. I know we don't have much time here and I don't want to take away from public comment. I will say one of the surprises for us was that in the provider, like feedback in the specific focus groups related to other people wear multiple hats. So we heard from hospitals who also spoke to us about employer concerns, who also spoke to us about, you know, like, so it's not cut and dried. So you're not going to see it just focus group by focus group, because there was a lot of cross-cutting feedback. But I do think that you will see some really helpful, specific feedback about provider topics and those questions.
And it will not say anyone's name.
No, I've got that.
Organizations.
I've got that. I just wanted to hopefully that we would
Yeah.
hear some specifics, because we
Yes.
keep saying we need to hear from them.
Yeah.
Okay.
Great. So we have a reflection from Chunwei.
So the reflection I shared is from one of my arguably most important mentor in health system and health policy, Professor Robert Evans, who retired from UBC, but who was instrumental in Canada's universal healthcare policy, and who was always at the forefront to defend universal healthcare, particularly against all the assault from politicians and some academic from the United States to smear Canadian universal healthcare system. So this is one of my favorite quote, and I took the picture. In 2008, he was a keynote speaker for Oregon Health Forum, and he invited me to join him in that Oregon Health Forum in a panel discussion. So this quote, single payer public financing creates an institutional environment, encourage the supply of ingenuity to contain costs. Costs are higher in multi-source funding system, where ingenuity is diverted into shifting costs onto someone else. And I encourage you to read more of his articles and books. He actually authored one of the earliest and still most popular textbook on health economic, titled Strength, Mercy, that published in 1984. And I used that textbook for a long time for my courses. In 2018, I organized the Universal Healthcare International Conference on OSU campus. I invited him to be a keynote speaker. Mike was there.
Wow, 2018.
Yeah.
Thank you, Chunwei. Do we have a volunteer for reflection for next month?
Is that even done?
Yeah,
I can do it.
great. Thanks, Cheryl. Excellent. Great. And with that, we are adjourned. Thank you all very much for your participation, and see you May 12th.
Thank you.
Thank you.